We'll now start our next panel for FIS 21, the main event of its kind in Latin America. We know that technology has had a huge influence in medicine from the moment of hospitalization till the moment the patient is discharged. Yes, exactly. And that's what our next panel is going to talk about. New care models of connected health and digital patient. And for this panel, we have Paula Mateos as a moderator, and panelists will be Bruno Piponzi and Guilherme Salgado, and founder of the 3778 group, as well as Gui Azevedo. Mr. Paulo Chap will not be able to be with us, but he will be represented by Paula Mateos. Don't forget to follow the FIS initiative on social media, and always use the hashtag FISWeek. We love seeing what you're up to. Let's get started. Hi, good morning. It's an honor and a pleasure to be with you today. It's a huge responsibility being a moderator and replacing my dear friend and mentor, Paulo Chap. We're going to have a very lightweight, very nice discussion about our healthcare models and connected health and the digital patient. And since I'll be the moderator, I'll let you introduce yourself and tell us about what you do and your story. But to get this discussion started, let's talk about the healthcare sector versus the disease sector. I think we've been calling the disease sector healthcare sector for a long time now, and these are very different things. The profile of patients is extremely different from the profile of consumers. As the name itself says, patients are patient. Treating a disease is not a nice journey. And when we talk about the concept of health, we talk about the profile of consumers. And of course, consumers are looking for something fun, something nice. And I think that this is what you're bringing as differentiators to the table, creating a sense of community, bringing fun to the scenario, leaving disease aside and talking about health. So I'd like for you to start out by talking about that and talking about the differences in terms of the consumption profiles in the healthcare sector and in the disease sector. Who wishes to start? I can start. Sure, over to you. Good morning. It's a pleasure to be here. I want to thank FISWeek for the invitation. It's the first time I'll talk about Vitat. And to quickly introduce myself, I'm Bruno Piponzi, the executive leader or CEO at Vitachi. I'm also the vice president of businesses at ID. Vitat is a platform that was born within the RD group. And yesterday, we celebrated our 10th anniversary in the role. A very fortunate occasion for us, and also a very transformative moment. During the last years, we've been looking at a very deep transformation of a company that moves towards integral health. We are traditionally known as the retailers of pharma. And we started a project to transform health. To summarize, and so that everyone understands, we really started to understand that pharma will take on a different role in the future, and that pharma needs the pharmacies need to be a point of contact, not only to distribute products, but also to offer healthcare services focusing on promotion and prevention, as Paula said very well about the importance of starting to have a more preventative approach and to become health promoters to avoid the current problems in the healthcare system. And that's why this project was born, the healthcare platform. It's a way for us to connect pharmacies to other services and solutions that are broader, but always with this type of focus. And the biggest gift we can give to our customers is the preservation of their health, and not by providing them health care after they're diseased. Of course, that's necessary, but ideally, that should not be the case. So it's based on that perspective that our solution was born. Hitachi was born as a platform that expands its healthcare solutions, starting from the pharmacies. And I won't take too long talking about that. We'll talk about that more during the panel, but that's how Hitachi was born. We wanted to be a brand that was positioned in the scenario of full health, and Hitachi is connected to vitality. So basically, that's it. And let's continue. Gui Azevedo. Hello. I'm Gui Azevedo. I'm a healthcare leader at Lisi. And Lisi is building a new healthcare system. As you said, when you look at a traditional healthcare plan, they're more like an insurance for when you're ill. If you talk to somebody, the person, when they choose the healthcare plan, they think about value propositions and, well, if everything goes wrong, what will happen? What's my coverage? That's what they think. But when things go wrong with my health, right? And health, most of the times, most people are not ill. So this is how we see it. And well, how can we build a product that could help people become healthier, and a product that's also there for them when they're ill? So we focus on health promotion and on coordinating healthcare end to end when people need more specific care. So we see the journey of an individual as a whole. Let's say when a customer procures our product, we offer physicians, nutritionists, physical coaches, nurses, our own teams. We have our own technology, our own communication channels, and they're there for 85% of all health related situations that customers may need. And that team coordinates and refers individuals to secondary and tertiary care, which is our community that it's usually what's called the accredited network, but we don't like that name. We call it a community, a healthcare community. And the healthcare community will then continue giving healthcare to patients. And we have this cross-sectional longitudinal view integrated in healthcare data, not only transactional and financial data, clinical data. So from secondary and tertiary care, we can We monitor what's been prescribed to patients and all that. Alicia is healthcare administrator. And in that regard, we're trying to launch a different service. Salgado, since you're going to be talking about 3778, what does a 3778 mean? People love to ask that, right? And then we'll move on to our round of questions. Thank you. It's a pleasure to be here. Well, it takes a while to explain what the name means, but it's play number 37 and 78 from a Chinese chess. And the guy talks about these journeys when the chess players, one defeated another, and artificial intelligence defeated a great player. And that's usually when people say that 37 was the best move of the machine, and 78 is about the best move of human beings. So that's what we believe in, connecting people and technology in healthcare. I'm the CEO of 3778. I'm a physician and specializing in labor medicine. And that's something that we really need to change in healthcare, because we use it too little. And 3778 was born to be a healthcare manager focusing on data and corporate health. I think we have a huge challenge in that we're an independent player. We are not a hospital, and we are not an insurance company. That's how we see ourselves. If patients already have an insurance company or already are directly connected to a hospital, we are then administrators of that, end to end, without too many frills. We want to provide a different, to cater to different needs of different people at different times. And there's a consumption profile that really varies a lot between people who are ill and people who are healthy. And they both need very different journeys, even though we have high-end hospitals and top-notch healthcare. You can improve, I won't mention the outcome, but at least the experience and the costs to get you there. And I know that Alicia is doing a great job in having access to healthcare insurance plans that give you access to the best community, the best healthcare network. That does not necessarily mean that your journey is adequate for you. And being able to design a cost-effective, at-scale healthcare journey, for that to happen, for one, we need to have data to do that and be able to use everything we have in the healthcare budget and in terms of healthcare initiatives happening in the healthcare system. There's already a lot of money in the system and in the company's budgets. And now this is totally disconnected. And each one is looking for sometimes antagonic results within the same system. That's what I wanted to say. And also say one more thing about the disease. We used to say that we are in a disease system, and we have to transform the experiences of anybody who is being treated, because when we treat them, they are diseased, and the experience is widely different to any other experience of a healthy person. In another, we discussed how much we are already exchanging information within the ecosystem, looking at what users need at the end of the day.
essa experiência do cliente que muda nesses dois setores. Muito se fala em colocar o paciente no centro, mas a verdade é, eu digo isso como médica também, que ele nunca esteve no centro. Não adianta a gente ficar aqui puxando o mercado. Ele nunca esteve no centro nos sistemas atuais, tanto no público quanto no suplementar. Ele começou a estar no centro nesses sistemas alternativos que estão sendo criados, né? Aonde ele passa principalmente a ser a fonte pagadora. Porque quando ele não é a fonte pagadora, ele já não está no centro. Ele vai ser enquadrado lá num processo, numa caixinha, e segue nessa caixinha. Então, é disso que eu gostaria que vocês falassem um pouco, inclusive o Gui Azevedo e o próprio Piponzi, de como é que vocês estão colocando o paciente no centro de verdade, né? Com essa experiência gostosa, dentro de um modelo de saúde suplementar e o Piponzi dentro de um modelo de saúde out of pocket, né? Que é um sistema alternativo. Eu acho que isso é uma coisa que eu gosto de falar sempre para o público. A gente tem hoje dois sistemas muito claros de saúde no país, que é o sistema público, né, que todo mundo conhece, o SUS, e o sistema suplementar, que suplementa. E a gente tem um sistema alternativo que ainda é pequeno, é de pequena expressão, onde são pessoas fazendo coisas diferentes. Então, mercado out of pocket, mercado de marketplace, mercado de compra, né, direta. E é aqui que eu vejo o grande diferencial que está acontecendo em modelos assistenciais, que é o tema do painel. Então, invertendo agora, começando com você, Azevedo, fala um pouco dessa experiência do cliente, da jornada, de como é que você está colocando ele como consumidor no centro das atenções no palco.
Obrigado, Paula. Esse é um assunto, eu vou ter que me segurar aqui para manter o tempo, porque é um assunto que é o centro da Alice. Alice chama Alice porque Alice é o nome de uma pessoa. Tem uma pessoa específica, sim, a gente escolheu o nome que a gente curtia, mas Alice tem o nome de uma pessoa para a gente sempre lembrar que a pessoa está no centro de tudo. E no caso Alice a gente chama, né, quem usa Alice são membros ou membros da Alice. O que a gente está construindo tem tudo a ver com a confiança e criação de uma relação empática, assim, que é o papel dos times de saúde. O time de saúde é uma coisa muito particular da Alice, assim. O que a gente desenhou e construiu aqui em condições que eu expliquei, tem muita profundidade, assim, por trás. Não é apenas atenção primária. E o papel do time de saúde é ser o porto seguro do membro que olha e fala, poxa, eu tenho com quem falar o tempo inteiro, 24/7, né? A gente tem times de saúde agendados e imediatos para PS digital. E os times de saúde são da Alice, né? São terceiros e tal, são times da própria Alice, assim, 150 pessoas que fazem só isso, que tem o contexto, tem o histórico de saúde das pessoas, e a gente usa toda uma lógica de priorização. Então, quando você acessa, por exemplo, no Alice Agora, que é o nosso PS, né, digital, você fala com uma pessoa que provavelmente já falou com você antes. Então ela te conhece. Fala, oi, Paula. Tô vendo aqui a sua dor de cabeça aqui. Você teve semana passada. Tem contexto, tem pessoalidade, acima de tudo tem amor. Então, isso gera o quê? Essa porta aberta digital e essa personalidade gera o quê?
This digital open door generates what? Before, amongst other things, confidence, empathy, confidence. And when the person thinks about health, when the member of health thinks about health, they think about the health team and the decisions the member is going to take that are complex. They don't make them alone. The team helps and coordinates the person to make decisions. So the consequence of that is that 98% of the events that happen in secondary and tertiary care have been coordinated and forwarded by the primary care. It's very crazy. Only 2% of people say, no, headache, I'm going to a neurologist, ER. They sort of trigger the health team. They can call them physically. So we have sort of outpatient clinic that we call Alice houses, and then they're going to be referred to secondary, tertiary. If the protocol considers pertinent to go directly to ER, they will. What is incredible is 98% of events, people count on a health team, and they do what the health team is supporting them in a coordinated way. This reduces a lot of waste, but more than anything, it increases pertinence. More than anything, it's a greater demonstration that the person trusts Alice and the health team, the person's health team. To me, this indicator is incredible. This means that we have the person in the center of the whole experience. So it's our NPS is close to 90, and our SAT from 0 to 5. So for all events when the person is cared is 4.93. So it's all about experience, the journey of the person that matters most. Once the person trusts Alice, the care, the pertinence of what's going to happen is very much related and much more appropriate for the person and for her health system as a whole. And sort of adding to that, I'm going to add to what Goza said. And so you're creating a concept of loved brand. I've always told doctors, there is no love brand in health. Nobody wakes up in the morning and say, I love A and B. No, nobody says that. We are creating a concept of a loved brand, a concept of community. So we're moving out of the box of being just the digital health operator and opening this community to specific acquisition, one-stop shop for those that cannot buy a healthcare insurance, but actually being able to access your digital ER, etc., for specific things, considering that the consumer wants to have convenience. And it is real. When the pre-pandemic period, we forced people to displace themselves to literally for low complexity urgencies, both in the public and private sectors. I woke up with a sore throat, I had to get the car, go to the ER, wait, the public system, take a bus, subway, miss a working day, 3 hours waiting in the line. This is the reality. Today, you can do everything in this device, regardless of where you are. So the patient has learned to become healthcare consumer during the pandemic and learn conveniences and comforts. They liked it with comfort. So conveniences that we have with iFood, etc. So the TAT started realizing that, considering wellness, well-being, and obviously this scope, the portfolio is going to grow, and you already have huge retail experience, and you're going to start with service retail. I'd like you to tell us about this part of service retail and retail, what you're doing in health, how you can use this experience of the pharmacy of the future that no longer sells boxes, but services, and to promote health in cases that are phenomenal of engagement. And that's where consumer goes. In the pharmacy, they're used to being in the pharmacy. So it's an engagement point that is very important that I'd like you to tell me. So I'd like you to score this goal so that we can move on to Salgado. Thank you for bringing up this ball for me to sort of kick it towards the goal. So you know several things you talked about VITAT, but I'm happy to see that the concept is so clearly put. Actually, I think that connecting to what Guy said, this movement of customer or focus is part of the VITAT within this action. When we started thinking about RD was a company, so I've been here for 10 years. It's been a very successful company in pharmaceutical retail and lived a cycle of prosperity growth very strong since the merger in 2011 until today. Until 2016-17, it was very much retail. And retail, very physical, with digitization at a stage that was more initial. We're not from a retail segment that was so quickly impacted by digitization, but between 16 and 2017, so we see the digital transformation moving fast. So there was a change in the mindset, digital transformation. That was important to have the customer oriented practice. So this was part of the digital transformation that was moved beyond. So from the time you really understand the client and their needs, I have to see how the business can evolve. It's not digitizing the business and say, okay, we have to be better at retail, introducing digital channel connected to physical one. It was not just that. Could be, but it wasn't that only that. What we concluded over the years between 2016 to 17 is that our role as a company should change and evolve. And that's everything. Since we are a pharmacy network, first point of our thinking came from the pharmacy. What is the role of this pharmacy? So if it has to be transformed, what is this role? So then you ask the client. When you go deeper into this understanding, you get to the point you were talking about. The pharmacy is a meeting point for people. The pharmacy, we have 2,400 stores in Brazil. So we have a physical contact with the clients that is very good. We have that team of caretakers in the pharmacy, pharmacists, clerks, and they're there, or shop assistants. So people go twice a month to the pharmacy. So we see the clients when they go and buy a product from us, they're not looking for the product. They have a problem, something related to health, and they're going to get part of the solution to their problem there. They're going to buy a drug for diabetes. I'm not just in need of the drug. I need in this journey, I need a nutritionist. I may need a personal trainer. I may require other healthy food items that perhaps are not sold by the pharmacy. The journey of the client that goes to our pharmacy is much broader. And that pharmacy, we understood, we're still restricted. We participate little in this journey of caring for the patient. And following that, with this insight, we realized that if the pharmacy cannot provide that it's not its role to provide that. We're not connecting the pharmacy to all the rest, because the entrance door, we have it. We are this entrance door. We have the relationship. We have the human contact. So what can we do? We can add more to this pharmacy, bringing more services in. We can diversify more our mix, bringing more of the concept of healthy living there, or wellness. And we, more than anything, we can connect it to other peers, to other service and product providers to be part of the client's journey. So this is what they are seeking. That's how VChat was born. It was created as a platform that is going to connect this world of 2,400 stores for up to 40 million clients connecting to the stores. And we go beyond, and we're going to connect through a marketplace of products. It's very specialized focus in health. So we want to bring an assortment much broader of healthcare products focusing on prevention, and marketplace of services, health services. So we want to complement connecting the pharmacists with doctors, nutritionists, personal trainers, psychologists, with labs, with gyms, fitness centers, with other agents in the health system that can articulate and act with us in network to provide more complete health solutions to our clients. So VChat's vision was born from this vision and the understanding that we had to go beyond, because there is no longer a linear business model that I'm a pharmacy, they are a hospital, they are a lab. No, we have to articulate ourselves. We have to connect to bring more complete solutions. To wrap up this focus of prevention and health. That is our focus, our role to promote health, because we are close. And for that, we have to work very much this concept that we've been talking previously, to make health become something nice. Health is, being healthy is eating salad, to sleep early, and I want to go dancing. And so you have to start and sharing with people the vision that being healthy is nice. And the pandemic has shown that the interest of people have increasingly more to be healthy and updated with their own issues, to live well, to have good quality of life. Hence the need for us to encompass all of that within a brand that brings this concept of life that is good and that is aspirational, that is love. That is loved, to build a brand that inspires. Health is cool. It's not a disease. Health is the lifestyle, and this is what WeChat is proposing to bring.
That was awesome. And now I'll give the floor to Salgado. You represent a corporate health company, one of the biggest groups of corporate health in Brazil. And that's what you do. Some people say they do that, and actually you do it. I think the biggest difference is that, well, data doesn't mean anything. Data is important when you can do something with them. If you're in a company, for instance, and there are 30 people who are diabetic in that company. So, okay, what do you do with that? And if we apply that to corporate health, and here I'm making a bridge with Bruno, if you get connected to a Vitachi, you'll gain in penetration, because that individual that works 8 hours a day, and if they've taken a leave, or if they have to take a leave for a matter of primary care, they'll leave the company, and at least maybe twice a month, they'll go to a pharmacy, maybe not to buy medicine, but to purchase toothpaste or a hairbrush. So when I see this corporate health going beyond the borders of a company and able to engage patients in other points, then we start seeing new healthcare models. So I'd like for you to compile all that, what happens inside companies, and how 3778 is being able to expand that beyond the borders of companies. And I know that you do that. You're on mute. Yes, like Ponzi said, we don't really use what other players from the ecosystem can give in terms of benefits to people. And I think that corporate health needs to be transformed and not digitalized. And that's where it starts, because the periodic health exam was created to be a touch point for people's health, and to understand how people's lives are evolving before they become ill or after they become ill. And what he said is that the fact that you have a health condition does not mean that you should not promote and prevent disease. Like what Ponzi said, well, I'm super healthy, I don't have any disease, I'm on Instagram and LinkedIn, and I'm truly an example. So there's nothing for me in there. But the fact is, there is something for you. So understanding that to engage people, when we look at the periodic health exam and what we can generate from there, you start getting to know people before they need to consume. And that's very, very relevant, and the population as a whole. So the first thing that we work with is to make sense of something that does not make sense, to transform that into something that you really see value in. It really changes. If you ask people who would like to do a periodic test, no one will volunteer, or who would like to do a checkup, everybody will like to volunteer. No one will get the results of the exam, but they want to do it. They want to take the test. So first, okay, if there's nobody to monitor me, we know that if there's any problem, I'll be there. There are some cases where 70% of people that do a checkup will not come back to get the exam results. And again, that relates back to fragmentation, and hence the data that you talked about, the importance of understanding people and understanding the journey as a whole, and where other players come in. You talked about having to travel. there are certain portfolios where the main point of non-adherence to the pregnancy program is related to transportation and commuting. Sometimes having to take a 2-hour trip, you're pregnant and you're feeling sick, and you simply don't go, right? So understanding that and bringing that with all of the touch points we now have within the company to take that outwards is something that we're doing. So the transplants make sense. That makes sense for us. Every touch point, absenteeism or leaves, transactional data, all of our projects, we've been working on how to transform transactional data into data that we're able to understand the possible journeys that happened, to propose different journeys. And along those lines, we have some pilots going on based on the simplest data we have. We propose full journeys that include medicines that that person is going to need when they need it, because that's another point of adhesion to treatment. It's all about access, cost, and making access easier. We firmly believe that being cost effective promotes access. So, especially in the context we're in. And to mention another experience, it was a specific company, and everybody in Brazil has a smartphone. In theory, everybody would have access to digital health, but in practice, people didn't have data, or the way they used their smartphones made it almost impossible for them to adhere to a digital journey the way they're set up today. So what does that mean? The project that we're making, is it really making a difference in people's journeys? There is a large number of people that we don't have data for. So how can we solve that? And again, there's this fundamental role of companies. When you look at the journey as a whole, it sometimes makes sense for you to fund that data so that you have the necessary information and for it to be there when you need it. That is an extremely important incentive when it comes to funding. And also moving away from the one-size-fits-all recipe and becoming effective at being able to do what we have to do. I'm talking about the system as a whole. I still believe that we are still on a journey of digitalizing. We're still replicating things that we did in the physical reality and bringing that to the digital world with little articulation, with little connection. And that's what we are proposing. It has to be coordinated. It has to be integrated. And what we do is to bring yet another piece of this puzzle and this context of people that work for 6-8 hours a day for them to become another agent for this engagement. You mentioned a very interesting aspect. You have to know your customer and their pain points. There are many startups that simply want to impose their products in the market. But, well, it's very clear. Why don't pregnant women go to the appointment? Because it takes too long for them to get there. And in terms of health, I come from public health. And the business model, I did it when I was a director of a public hospital in Santa Catarina, where I was the health secretary. So I would create the rules and I would sign them. And well, when you have this power, you can do it. But it was a small city where trips were easy. And when that model was taken to São Paulo, the biggest cause of a no-show for patients in the public health system line they're able to make an appointment at a private hospital and they wouldn't show up. Why? Because they were supposed to be there at 10 p.m. and there was no transportation. So that's what it means for you to really look at your customers. How can you solve that? Well, by making a partnership with Uber. If you don't look at the journey and if you don't try to solve it, you end up creating a product that you may think has no penetration in the market, but that's really because you're not identifying the pain. When you talked about checkups, well, checkups are the most boring things in the world. No one wakes up in the morning and willing to do a checkup. I'm a woman. They'll simply grab my tits and stick things into me. I'm not a masochist, right? So you have to transform a checkup into an event. To go with my university friends somewhere, and we go to a beauty salon somewhere, or do a hairbrush to bring other elements that make a checkup something fun. You can go to somewhere where there's a show and people get together in a happy hour, and in the middle of the way, you're going to do a checkup. Otherwise, you're not going to do it because no one wakes up in the morning. I won't talk about male checkup. I've talked about my own. So these concepts that I see of new healthcare models have to be implemented. First, to get connected to several verticals in society, and to bring Uber into the equation, for instance, because we know that transportation is the most difficult thing. Well, you can create digital access, but if you do that, people may not have access to the internet to download it. Their data package may be too small. So will the company fund that? Well, he's diabetic. We have to engage them. So we have to open up our minds if we want to get results, because the mindset that created our current problems is not the same mindset that will solve our current problems. We cannot say that there's a shortage of money in healthcare. That's an excuse. People think that they're billionaires. They spend huge amounts. The United States spent $4 trillion in health. Are Americans healthier than Brazilians? Spending too much does not equate to spending rightly. And bringing these concepts of being conscious in what you're spending with, and health is about connecting. There's no use saying that we want a connected health and you don't get connected to logistics. Well, patients have to come to us. So let's use pharmacies that are everywhere. Pharmacies have a Wi-Fi connection. You can do corporate management through those touch points. So I think that we have to bring more discussions like this to the table. And maybe we can have one discussion like this every 2 months, and sit together and think about how to connect all this to come up with a new healthcare model. Because we know that the way we were doing things, we know what that will result in. And I think that you who are coming into this scenario are doing different things. We're now moving towards our final minutes, and I'll leave you free to discuss. We talked about making a checkup fun thing, connecting people, easing transportation. So maybe you want to bring another different element in that regard to the audience, and the audience that that does not know what you're doing. People know what conventional healthcare is, but there's many people that are doing great things below the radar. Well, there's one thing that really connects with what you said. It's a message that's really nice when it comes to rethinking what healthcare means, and connecting with the checkup. Like you said, we have this perspective that taking care of your health is, doing a checkup every year. I take good care of myself. It's not like that. It can be a great experience, but at the end of the day, I could have maybe 1 or 2 parameters misaligned. You talk to a physician, he'll give you the instructions, and 1 year after you're going to go back there. And one very nice thing that really sits at the origin of what Hitachi is that your health is going to be determined during that period between checkups. A checkup is simply a snapshot where you render accounts and think, well, I'm well or I'm not well. But between two checkups, that's when everything happens. And there's the point when you are or not taking care of your sleep pattern, your nutrition, that you're more or less concerned with physical activity and mental health, the health of your relationships. So when we talk about health, and that comes from this heritage of a system, and let's be fair, the healthcare system solved countless problems in the past. If you think, the system only focuses on diseases, but if we go back in the past, we will see that the causes of death in the past would require a system designed the way it is designed now. But with time, this system triumphed and people started surviving more. And little by little, diseases that were big problems, those diseases now are the result of longevity, which are chronic diseases, the biggest causes of death, cancer, for instance, associated to aging. So if you look at the model, you think, well, and that was one of the biggest things about Hitachi. We think, we have to address what happens to individuals between medical appointments, between checkups, which is actually when you determine your health and longevity. How you eat, how you exercise, and it's hard. We talked about engagement. It's much easier to engage somebody if they're in pain than otherwise. The chronic diseases are extremely silent. Some people will spend years and years simply not knowing that they have a diabetes that's totally out of control, or hypertension. So the biggest challenge ahead of us is about rethinking health, and for us to understand that the main factors are changing our habit and engagement and monitoring them. And that, to me, is the biggest challenge. When it comes to retail, what's the power of retail? It is to have this physical contact, this routine, and this follow-up of your customer, and them being there with you when they're consuming a product, whether it is a healthy food or a vitamin, when they go to a nutritionist, to a psychologist. We have to look for ways to engage them in this routine so that they have an impact on their health during these moments, these gaps between checkups. And checkups are, again, extremely important, but they're just a snapshot of the checks and balances of our health. So that's a very nice impact that I wanted to share, because Hitachi that's what it's all about. Our goal is to address these issues that will make people healthier in the long run, and also take off the pressure of this system. If it continues like that, it will start seeing more and more bottlenecks. The way it is now, it's much more reactive than preventative. And that's an essential problem. Thank you. Do you want to make any comments? Or I can ask, I have two questions. No, you can ask the questions. I fully agree with Bruno. Well, I just want to add something to what Bruno said. Checkups, isolated. There are publications in the United States. It says that it hasn't improved people's health. And doing a checkup just for the sake of doing checkups, well, that is no good if it's not combined with the change of habits. It's simply is there to make you spend more money. Yeah, in addition to being not nice, right? Yes. And that's one thing. we have so many things going on, so much data that people use for nothing or use very, very little. That was perfect. And there's the checkup providers. I'm in favor of checkups. I do a checkup every year, but it's all about doing a checkup in association with these elements. It has to be integrated, and that takes us back to a connection. Well, there's two questions that we received in the chat. The first one goes to you, Salgado. How to reduce corporate resistance to artificial intelligence and its algorithms, and how can we have traditional physicians incorporate these tools as supporting tools for the decision-making process. Everybody says that physicians are resistant, but physicians, as soon as they go to university, they're trained to study every day. Literally, after periodically, you have to study. And to give you an idea, the amount of medical information in the world doubles every 73 days. So every 73 days, we're totally outdated. So yes, we are trained to study. We're always innovating, always looking for new operation techniques, new drug techniques, new drugs. We're not resistant to innovation, quite the contrary. The thing is, we don't have an administrative related education or a technology related education, and we become resistant to that type of change because we don't know how to do it. That's the truth. If you don't know how to do it, then you become resistant. Oh, no, that technology, I can't deal with it, so it's no good. So it's important to understand where the resistance of doctors is. We are totally early adopters. We're trained to be early adopters since university. If you don't get updated, you'll be out of the market. So can you tell us how you're dealing with this resistance in corporations and if physicians are really resistant to incorporating technologies? I'll try to be brief. Well, talking about the resistance of physicians, well, that's good because quickly adopting, and of course, you have to be quick. You have to be resistant. And as we say, what happens between the research to the moment you take it to your office, there is some distance, and it should be like that. And technology that's what it is for. We have a lot of technology, a lot of data, but we adopt it. If you go to any big hospital in Brazil, you're going to see the sheer amount of technology that they have. And well, it's good that we're resistant, and that's the way we should be. And one thing that you mentioned is that we don't learn this perspective of the patient's perspective. We don't learn that at medical school. We learn how to solve a clinical problem. As Bruno put it, if somebody shows up at an emergency room, I have to solve it. Or if the patient is bleeding in front of you, you're not going to try to find out what everybody thinks about that, right? That's not how it works. But we can apply that to everything in health. I think resistance can be overcome by understanding and by discussing the gains that are there for everyone. That's another thing. We often build things that worsen the days of healthcare providers. There are physicians that have to open 4 screens to do a medical visit. And you spend so much time with that, then you ask people not to be resistant. Of course, they're going to be resistant. And we've been working on that, on showing the purpose, showing the whys, and showing the results, because it's a win-win situation for everybody who's in the chain, including healthcare professionals. And the resistance against the adoption of AI, to me, is natural against any new technology or new healthcare model or a new business model. Nubank, for instance, when it was created, if we look at what people think, or what people used to think when it was created and what people think now, it changed a lot. Artificial intelligence is yet another tool that, if we don't show consistently, starting out small, showing the results and showing where it makes a difference, we're going to bring more and more resistance. What we see frequently is unnecessary use and trying to do something very big before having incremental results. So we have very few operational models in artificial intelligence in health that do something different. The way to overcome resistance is to do what's necessary so that there are results. We can see the results and show them. Oh, you were brilliant in your comments. And that's a buzzword, machine learning, artificial intelligence, right? Okay, what books do you use? Oh, the books, I don't have them yet. Okay, so what are you thinking? I've been saying that a lot. Machine learning, it uses probabilistic data. Machine learning is a medium. You have to predict the future. The gurus from the past do not need machine learning. Looking at deterministic data does not require machine learning. So you see people full of BS when they start using that word, and you see that they're not using the technology. We still have 5 more minutes. They'll let us know. I have a question for you, Piponzi. Pharmacies showed their worth in the pandemic, guaranteeing access to people who didn't have it. The question is, what about telepharmacists to give support to pharmacies in small towns? Would that be a good solution? That's a great question, and a very nice one, because that connects us back to discussions and projects we have. Well, first and foremost, I think that the pandemic really brought about a lot of security for some theses that we had in the beginning. In 2018, we started assuming this perspective of pharmacies as being a point of entry into the system, and the pandemic really showed us this potentiality. And we actually ran over 3 million tests this year, COVID tests at pharmacies, and the role of pharmacists has really changed a lot during the pandemic, and how people are now associating pharmacies with the service and not simply with being a point of sale. That really changed.
The role of sorry, we had a, have you heard? So when we talk about telehealth, pharmacy teleservice, yes, we see this technology as a high potential and outreach technology. But we do not restrict this only to pharmacists. When we talk about the chat, let's talk about 2 things. So it's a great connection point that will bring this connection between various health care players. The role of Raya and Dogasil are going to have a pharma teleservice to give greater outreach to the pharmacy service they provide. But likewise, we can connect to, we can have these great technology of telespecialty, so to speak, so that we expand the outreach of these professionals with the public we serve and use the solutions. This vision is very consolidated today within the chat Today, we do some integration work with that, and certainly pharmaceutical teleservices will be one of the first that we're going to provide, considering the very origin of the chart within the system and considering health and profession. Thank you very much for the question. Wonderful. Gui, I want to ask you a question. You who always, Guilherme is a long-lasting executive ahead of his time. So you have corporate health, literally, with technological basis. So you have a marketplace, you see retail pharmacy moving into health service. How do you see this new digital operator, this new Alice model that has been trailing paths for a new model of digital operator connecting with these universes that we can, at least in this panel here, create a connected health system between three players? How do you see that? Where is the role of the operator within the other models? So, we are not an operator. When Alice is a health manager, it will take a while for the penny to drop. Well, many decades we've been talking about that, health service. So we are very within this concept, in this box, thinking within the box. Yes, open the boxes for me. Precisely. So we have deconstruct the box. It exists because somebody put the box there one day. Well, somebody has done it. Okay, cool. So we're making another box. So the other box is a health manager. In it, it has a product. One of the products that are part of the service is a healthcare insurance that is there for when you have a health issue, when you have to be followed up because of a chronic disease, etc. But you have other layers that are the layers of promotion of health, especially in healthcare teams. In addition to that, Alice will not provide a solution to all. What Bruno's saying is that possibly the person may need a given type of service that is not Alice's service. It is what we've launched now, version of Alice's app for people that not buy the whole product, so that people can try it out, and they may buy services that we sell or access to other free services. And for example, visits, appointments, so you can upload your tests on the app. And thinking about the platform head, it can access other services that Bruno is providing when they need to access drugs, and we can plug that into the context of their journey, Alice. So we, as the health manager of the person, we're going to provide part of the services, and we're going to integrate other parts of the services with external partners, as long as this resolves the journey of the person. And what Bruno is saying about part of their activities may resolve part of the journey of the patient once they've gone through an appointment, etc. So, or else, I don't know. A typical journey is nutrition. The person goes to a nutritionist, has an appointment, the nutritionist provides a diet or suggests a food change, and they say, okay, now I have to go to that place, find on the web and find all these things that people have prescribed to me. So I'm getting as a gift the list, but I'm getting as a gift the work of looking for all of that and buying that and making it being delivered to my place. How can we integrate the list from the nutritionist? So you click on it and everything gets to your place, and it's going to be on your monthly invoice of what you pay to Alice. You have this additional cost. So how do we integrate everything? So I think this is a huge opportunity. The point that I just wanted to bring up that is very important is that what we cannot measure, we cannot manage. So what's very important about data, I think a great lost link in health is basic. So, for example, a person has invested in a process of health promotion, treatment of a disease, and they have an outcome. And what I'm going to talk about is value-based medicine, tele-based or value-based care. How do you measure this result? How do you measure the effort based on the result? And how do we open this up? How can this be totally transparent to the health system? How do we know a hospital A in a procedure X is better than hospital B in the same X procedure? How do we know? How can we tell? How can we give more transparency? All of this is more on data, providing transparency to data. So to give you an example here, so analyze everybody that joins, we measure several things, we call quality of life, PhD, so the indicators of anxiety and depression. So to have some metrics on everyone after 3 months, we reevaluate, person asks again if they're in the program. So we have some basic, right? So they have to answer automatically. So today we can tell 76% of people, they improve their recall after 3 months of LS, 93% of people that have depression improve their indicator of depression. Same thing for anxiety, 80% improvement. Well, we measure PHK9. So how can we actually on the same journey measure the outcome? What I'm talking about is measuring outcome on resources that have been invested in the process of improving the health of the person. And then things start tying, and we start measuring in different ways of making decisions that are more cost efficient for those systems. So I think this is super important to me. This is the lost link, the health sector, in addition to the patient-centered journey, measuring outcomes, efforts, results on efforts, and delivery, right? Everything you buy and the rest of the economy sectors, you measure deliveries. You buy something, you receive something, and you measure the delivery, the result of the service you bought. And in health is still a bit cloudy. Okay, thank you very much. I've been told, yes, well, it's been delightful to spend this morning with you. Let's do it again. You're fantastic. Congratulations for your 3 initiatives. I'm super fan. 3778 is my neighbor, and this I always kind of tweaked a bit to see what they were doing. I've had the opportunity of talking to Criada times in the environment in Brno. For a long time, we've discussed things, discussing these marketplace models, how to be present in the sector. Thank you very much for your contribution. The kids, well, we don't know what happened to Dr. Shap. I do hope I have been up to brilliant Dr. Shap, and thank you very much and great gratitude from the bottom of my heart. Bye-bye.
A Abrange completa seus 55 anos de caminhada com o propósito de democratizar o acesso ao sistema privado de saúde, de eficiência e qualidade. Enxergamos o futuro com bons olhos, mas sempre priorizando o presente. Abrange 55 anos. Nossa origem, nossas histórias e nossas conquistas.
Desde que a Covid-19 chegou ao Brasil, uma força-tarefa de proporção histórica entrou em ação, ampliando a parceria entre os setores de saúde privado e público. Um conceito central para nós ganhou ainda mais força. A saúde brasileira é uma só. É um orgulho fazer parte dessa corrente. ANAP, Associação Nacional de Hospitais Privados. Unidos pela Saúde.
conhecimento transforma. A transformação te carrega para o futuro. Onde você quer estar daqui a alguns anos? Qual habilidade você quer aprimorar? Que profissional de saúde você deseja ser? Como caminhar de mãos dadas com o seu futuro? As respostas de todas estas perguntas não se alcança sozinho. Ask Mind, porque nós somos incansáveis por conhecimento. E você?
Bradesco Saúde desenvolveu uma série de iniciativas que promovem orientação e cuidado em meio à pandemia de Covid-19. É o Saúde Digital. Com ele, quem tem Bradesco Saúde pode realizar consultas médicas por videochamada sem sair de casa. Veja como funciona. Para dúvidas e sintomas de Covid-19 ou outras questões de saúde, você deverá acessar o app Bradesco Saúde. Se você ainda não tem instalado, faça o download gratuito na App Store ou no Google Play. Para consultas médicas regulares com médicos referenciados, acesse o site bradescosaude.com.br. Confira as especialidades disponíveis para atendimento por videochamada e como agendar sua consulta. Bradesco Saúde, ao seu lado contra o coronavírus. É pra ficar junto. Inspira. É pra saber sua história. É pro seu estilo de vida. É pra olhar nos olhos. É pra cada fase da vida. A DASA é uma rede de saúde integrada que acompanha as pessoas ao longo da vida. DASA é pra toda a vida.
Para ser referência em medicina, é preciso ir além. É preciso ciência, método de pesquisa, fomentar conhecimento, compartilhar e formar talentos. Ao longo do tempo, investimos para termos o melhor corpo médico, as melhores instalações, a melhor equipe assistencial, a tecnologia mais avançada. É nisso que acreditamos. É isso que buscamos. Somos o Hospital Moinhos de Vento. Referência em medicina, referência em saúde.
The body is an amazing organism, designed to run marathons. Think of ideas, and see a beautiful world. It's capable of complex tasks. But when the body is compromised by disease or disorders, disabled by trauma or wounds, it needs help getting better. And that's why we're here, to create medical technology that saves lives and changes lives. For the heart, the soul, the ambitions, and the dreams of every person we touch. We are here to innovate, to look at challenges from all angles, to follow patients beyond diagnosis, through treatment and recovery, to get them back to their best body, living their best lives, and being their best selves. Our ambitions are big. We are working to give people surgery without incisions, contact lenses that treat allergies, implants that monitor themselves, real-time maps of the heart. We are redefining what the body can accomplish. And even though we are a diverse group of businesses, we share a common goal: save lives and ignite all that's possible in everybody.
Super-heróis são seres com poderes mágicos que voam, que enxergam o que ninguém enxerga. Hoje, fica claro que vivemos rodeados de super-heróis, dirigindo, acolhendo, cuidando, que têm feito da proteção do outro sua missão. Eles sempre estiveram aqui, só estavam disfarçados. Homenagem a quem tem feito mais do que o seu trabalho para mais gente ficar bem. Mater Dei 40 anos.
Em 2021, o prontuário eletrônico do paciente do SOMV, solução da empresa para o setor hospitalar, ganhou pela 6ª vez consecutiva o reconhecimento de melhor da América Latina, de acordo com o Instituto Norte-Americano CLES. Uma vitória que é nossa, de cada um que trabalha na MV. Quem faz o PEP sabe que por trás da solução tem muito esforço, dedicação e comprometimento. É por isso que esta conquista não é apenas da MV, é do Brasil, é nossa.
Nós nascemos na saúde e nos movemos pela saúde. Impulsionados por essa paixão, nos tornamos uma das maiores empresas de tecnologia para a saúde do Brasil. Nosso caminho é trilhado por 400 colaboradores e mais de 6.000 clientes. Somos tecnologia que evolui todos os dias. Somos Fixion.
Inspirar pessoas a cuidar de pessoas. Isso está conectado no olhar e no sorriso de quem é Sabin. De norte a sul do país, o jeito Sabin conecta você ao que existe de melhor em saúde integrada. Construímos pontes e histórias para contribuir com a comunidade, o meio ambiente e com um ecossistema empresarial mais humano, diverso e inclusivo. Seja aqui na sua casa ou na nossa casa, estamos de mãos dadas com a inovação e tecnologia para que a sua jornada de saúde seja completa. Grupo Sabin, presente e futuro conectados com a sua saúde.
Nascemos com o desafio de mudar o olhar para a saúde de cada pessoa, transformando informação em conhecimento. Tudo em um mesmo lugar, dados e serviços juntos para permitir pela primeira vez que cada um tenha a visão completa sobre sua saúde. Todos reunidos em uma plataforma, unindo forças para criar soluções extraordinárias e oferecer todo o cuidado que cada pessoa merece e precisa, de maneira coordenada e digital. Afinal, acreditamos que usar a tecnologia de forma inteligente e integrada é o primeiro passo para preservar o maior ativo de nossas vidas, a saúde. ID. Toda saúde é única.
THB é uma das maiores consultorias em saúde, benefícios, seguros, resseguros e affinity. Com foco em inovação e proximidade com o cliente, a THB tem uma equipe multidisciplinar, com consultores especialistas na estruturação e administração de programas customizados. Fundada em 1978, faz parte do grupo MODELOS, o maior wholesale broker dos Estados Unidos, e está presente em todo o Brasil. THB, soluções que vão além do seguro.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui.
Our next panel is about the future of remote work in the healthcare scenario. We'll talk about a very important subject, especially now that it seems that we're moving towards the end of the pandemic. And a lot is being said about continuing or not with the remote work setting. And that's why we invited very important leaders to be with us. And they'll be our moderator, Alexandre Lucchi, Executive Director of Johnson & Johnson Medical Devices, Edson Pereira, CEO for Prevenials Medical Care in Brazil, and José Marcelo Oliveira, CEO of the Osvaldo Cruz Hospital. It will be a great discussion. Please don't forget to answer our survey. Just point your camera to the QR code on your screen and leave your opinion, which is extremely important for us. Let's get started. Hi, good afternoon. Good afternoon to everybody who's watching us remotely. It's a pleasure to be the moderator of this discussion with such honorable guests. I want to thank the organizers for inviting me to be here as well. As they've been introduced, we have two guests with us, José Marcelo Oliveira, CEO of the Oswaldo Cruz Hospital, and Edson Pereira, CEO for the Fresenius Medical Care in Brazil. Over the last 2 years, we saw a radical change about the concept of remote work. Remote work has always been a discussion in most companies, but it hit us as a devastating wave in all sectors over the last 2 years, and the healthcare sector was no different. Not only the production chain, the sector that produces, but also the healthcare industry, whose main characteristic has always been treating patients. And a lot happened during these last 2 years that led us to discuss and think about remote work and the connection between doctors and patients and new forms of connection, which brings us to this extremely rich discussion. We'll have a conversation with our guests talking about their experience and this perspective about the future of remote work in healthcare. From different perspectives, we'll have 10 minutes for each of our guests to explain and give us some examples of their experiences, and then we'll have 10 more minutes for questions. And of course, we can also take questions from the audience, and for that, please use the chat box. Now, I'll give the floor to Dr. José Marcelo Oliveira, the CEO of the Oswaldo Cruz Hospital. Thank you for your presence. You have 10 minutes. Thank you, Alexandre, for your moderation and for the kind introduction. I also want to thank the organizers for the invitation. It is a pleasure to be here talking about such pressing subjects for the healthcare scenario. Our goal, of course, is to grow this industry in the best possible manner. Of course, taking into account sustainability. Remote work is, of course, a sustainability tool for us healthcare providers. The Oswaldo Cruz Hospital is a high complexity medical center, and it was under a huge demand of patients looking for acute care after the pandemic, and it also had to remain active caring for other medical conditions in addition to COVID, such as heart diseases, cancer, and whatnot. So the experience that we can share is that at the beginning of the pandemic, disruptions such as the one that we experienced, and actually every industry experienced that, we had to react against the implementation of remote work because it was not part of our short-term plans. That was how the industry thought. And of course, that was already a change that was being slowly implemented, and working models associating that with the better lifestyle, more efficiency, more rational use of spaces. So it was not totally foreign as a discussion, but in practice, we initially reacted against that. And that created a perception that really concerned me as a manager, as an administrator of a high complexity hospital, which is to think about how can the culture of our institution deal with that situation, because not everybody could do remote work and work from home, because the very nature of our services requires that we are at the front end. So it was usually the back office team that was able to experience that setting. And initially, our concern was that, well, why can only a few of us work from home and not everyone? And that is something that happens if you're not totally planning for launching a huge change like this. So introducing this discussion was mandatory because that was in line of the best practices to contain the pandemic, which involved reducing the circulation of individuals. But there was also a certain association with privileges, and that was highly concerning for us. So the implementation of that scenario required a lot of communication and a lot of goodwill from everybody, people who had to be at the hospital and people who could be working from home. Because for on the one hand, people that were working from home felt away from the institution. It's just normal for us healthcare professionals to enjoy contact with our friends and colleagues. So we evolved a lot from this initial moment of reactivity towards a second phase that was more structuring, so to speak, where institutions started to provide resources and to think, well, this modality is here to stay. So which teams are eligible for that? And what are the models that we're going to adopt? And this initiated a discussion around designing the model, where the institution will provide methods, resources, and support, and will review its policies and establish new ones. Several professionals, and according to our experience, have been trying to check if they'll have the possibility of working remotely when changing jobs, because that makes better use of time. Displacement in Sao Paulo, in Rio, and other capitals, other big cities is always a concern and a challenge. So we started getting aligned to that way of thinking. And we have a work group with internal groups that collect people's perceptions, and also big institutions sharing best practices, and that involves the entire healthcare sector. And to try to give you a more objective data between benefits and disadvantages, what we've been able to see is that there's a positive impact on the team as a whole when we're able to offer that. And that will become point of attraction to some of our workers. The hybrid model will probably be a better match for this future that we will define, where professionals will have to work from the hospital 2 to 3 times per week, and there'll be a rotation. We can also see that during job interviews, collaborators, new hires already started asking us about that. Managers have to be prepared to learn to lead in this environment where a visual contact is secondary, but they also have to be able to promote interaction between the virtual team by mixing virtual activities with a regular routine. So what are our concerns? How can we design the ultimate support to these activities? What are the risks of these activities in this new model? Controlling the working hours, interactivity, and so forth. There's also the fact that the routine is tiring. I think we've all seen that. You don't have breaks, and you have meeting after meeting, and working hours are long, and emotional stress is not negligible in that regard. And the quality of connections and this virtual interaction, so that we don't lose sight of efficiency in this new setting. And there are no doubts that it does provide benefits. Digital platforms are transforming our lives, both as individuals and as professionals. So it is a context that, in my opinion, is favorable to transformation, but it requires preparedness and requires thinking about how to advance with the workforce that was used to a more traditional model. And hospitals, which are the highest complexity institutions, are more traditional. During the time that I worked with diagnostic medicine, it was actually a different environment, because you can have a little bit more flexibility because your level of interaction with patients is lower. But in a high complexity center, all of the collaborators experience the intensity of urgency of an environment where you have to make quick decisions, regardless of whether you are working physically or remotely. You have to make faster decisions. If you think about a back office activity in a hospital to authorize a procedure, for instance, okay, that is a quote unquote bureaucratic activity, but it happens with patients that are in the ER waiting for an authorization to be sent to an ICU. So we have to work with that time frame, the entire group of workers, and that puts pressure on the system, regardless of whether you're working from home or from the office. And a second element to get us started in the discussion is that patients also demand remote services. So this organizational capacity to interact with people remotely tends to increase. The process of screening before the patient goes to the ER, remote monitoring of signs and symptoms, interactions, telemedicine, electronic prescriptions. This entire environment is here to stay, the way I see it, because it adds value, and institutions will move towards that as organizations. So, Alexandre, to get us started in this discussion, those were my words, and this is how I see things. And I'll give the floor back to you. That was great. Thank you, Jose Marcelo. And there's a survey that was published this week, or end of last week, mentioning that over 2/3 of women intend to switch jobs if they don't get more flexible conditions. Of course, that's a much broader survey, more generic, but those are very representative numbers, which connects back to one of the things that you said about the fact that there are possibilities of transforming the context, and that's connected to all other digital transformations. So thank you for the discussion. And now I'll give the floor to Edson, who is the leader in Brazil of a multinational company that's present in several countries. And in the production chain, they're also linked to a highly critical line of work due to the conditions that the company deals with for renal patients. So Edson, I'd like to hear it from you about what this period was like and how you see a transformation in healthcare moving forward. Thank you. I want to thank Josenier and the FIS team for the invitation. It's an honor to have the possibility of discussing ideas and the future of remote work with you. Maybe not everybody knows the Fresenius Group, so I want to explain what that is. We are one of the biggest healthcare companies in the world. As you said, we are present in 150 countries. We have over 30,000 collaborators, and that's a pretty broad portfolio with pharma products, medical devices, equipment, and we also provide services with our medical care division. And I'm the CEO for that division. We treat around 110,000 patients. We have a hospital division, Elios, that's quite large, with around 150 hospitals in Europe, in addition to several low complexity clinics. And I think I should also mention that this year, we reached 5th place in the global ranking of healthcare and the development of technology. And before we talk about remote work, Alexandre, I want to give a bit of context about our situation in Brazil. And I'll make a connection with remote work to make it clear that the need for us to advance in that regard is high. Dialysis, we have huge challenges in Brazil. To give you an idea, only 7% of Brazil's municipalities have a dialysis center, which requires patients to travel for hours, kilometers to get treatment. Another important aspect is the scarcity of specialized doctors. In Brazil, we have around 4,700 nephrologists that represent less than 1% of active doctors. If we consider that around 10% of the population has some level of kidney dysfunction, to get adequate care, we would require at least twice as many professionals. So it's a specialty that's been attracting few young physicians. Many residency programs, even in large centers such as Rio de Janeiro, will go without a candidate for years. And just as with any chronic disease, given the aging of the population, the number of renal patients has substantially increased in the last decade by 70%. We have around 150,000 people being treated chronically. But if we make a connection with other neighboring countries in Latin America, given the size of the population, we should have at least twice as many renal patients. And we simply do not find these patients because they're dying due to other comorbidities associated with renal disease. So an absence of adequate diagnosis renders the line of care totally ineffective for these patients. And there are other treatment options such as peritoneal dialysis that allows patients to be treated at home without healthcare professionals, with self-care. But unfortunately, due to the lack of payment increases by the public health system, due to the lack of economic incentive, this type of therapy is practically being extinguished in the country. And now to talk about remote work, I will share experiences, our back office experiences, quite similar to that of our colleague Jose at the Osvaldo Cruz Hospital. And we didn't know if it was going to work or not in the beginning. And we know that the back office activity in the healthcare industry, if it does not work well, it will have an impact in the treatment outcome, and even result in death for the patient. So our experiences were quite similar, so much so that I am here working from home. I've been going to the office twice a month, mostly to meet people in person, but we've been having strategic meetings, acquisitions, restructurings, and things that we could never imagine that we could do remotely. And we are perfectly adapted to that. So I brought a few examples. Fresenius believes that in the future of dialysis will be much more like a self-care treatment that you can do from your own home. So following that perspective, in 2019, Fresenius made substantial investments by acquiring a company for $4 billion in the United States, where we acquired a portable dialysis system to be used at home for self-care. And all of the data resulting from that treatment is transmitted to a medical team that's located remotely. And that gives us a very clear example of how remote work can help frontline workers. In Brazil, we also have this treatment option, kidney dialysis at home, but currently you have to have the assistance of a healthcare professional. And for that segment, and in the before we would do at-home visits, we implemented a series of processes and protocols, and now we're able to do a tele medical appointment, and we use a checklist, and by having trained professionals, we can assess if that patient's home is eligible for that or not. Another interesting observation that I want to share with you from the perspective of treating renal patients is that usually they have lots of comorbidities. We have an app called My Comorbidity that allows for a quick interface and with other physicians that participate in the line of care of that patient, with cardiologists, endocrinologists, pediatricians, and those professionals can follow up the history and evolution of these patients remotely through the app. I also want to mention our training center, which started operating remotely. I don't know if you're aware of it, but around 30% of patients intubated due to COVID need a very specific acute dialysis called continuous dialysis. And Fresenius, it was in October 2019, it brought to market a device called Infiltrate. That was before the pandemic, and we had plans for bringing this equipment to market and training people. And we were actually hit by the pandemic and surprised by it. And overnight, we were hit by a huge amount of requests and demands, and we could not train people. So we created a protocol for remote training for healthcare professionals that could use that device to treat intubated patients. And that was very quick. And it was truly gratifying to see that we were able to train an entire team of a hospital in the south of Brazil during a morning, and in the afternoon we were training a different team from a different hospital in the north of Brazil. So things that certainly, if it were not for remote work, they would never be possible. And I'm sure that Fresenius was able to help save some lives due to this initiative. And I also want to mention, we have a TDMS system, as we call it, that captures dialysis data directly from the devices. And with it, we're able to, within a period of 4 hours, which is usually the time frame taken by a dialysis session, we can return data to professionals in 40 minutes and reliable data. But the use of this TDMS along with our clinical data management system, Nephro system or others, it allows for the creation of an online database that transmits in real time to healthcare professionals information about every treatment that's taking place at the center, allowing a doctor in charge of the clinic to manage the treatment from anywhere. And they only need to have an internet connection. And I want to explain that this traffic of information follows all of the guidelines of the General Data Protection Law. So with that, Alexandre, I wanted to give you a few specific examples from the dialysis clinic. And I want to highlight that this is a very incipient subject. 5G is around the corner. It will allow for extremely fast data exchange around the world. We have the metaverse and we also have social networks, but the FDA has 12 platforms already approved focusing on healthcare using the concept of metaverse. It's very hard to predict every possibility that remote work will bring about for the healthcare industry, but I can assure you that in 5 years' time, we're going to be seeing a very different reality. I had the opportunity to watch a different discussion. And there was something that one of the speakers said that was very interesting. And I want to quote him. He said that doctors will not be replaced by technology. They'll be replaced by another physician that's willing to use technology. Of course, he gave the example of a medical doctor, but that can be applied to any professional. If we do not adapt to technology, if we do not use technology in our favor, we're going to be hit by that wave and others will come behind us. That's inevitable. If we could block out technology and stop the future from happening, we would still have chariots traveling our roads. So I would invest our time and energy in trying to learn these technologies and be part of them. But this is a fundamental discussion talking about the countless possibilities of remote work. And it's a pleasure to be part of this panel and somehow be able to contribute. Alexandre, you have the floor.
Excellent, Edson. Thank you. We have a question on the chat, and I'm going to organize things and address questions separately. So we have a question here for Dr. Oliveira, which is, what was the impact on productivity for the associates that work, especially in the part of the relationship between suppliers and all the support you have in the hospital part with doctors and hospitals? So we have a large demand or visits or physical relations that are appointments that existed in the hospital and all the companies that provide services to the hospital. And this relationship somehow was no longer physical and started being remote. Any insight, any reading of the trend in relation as to how companies relate to hospitals considering this transformation? Alexandre, the reflection I made, we are not yet living a normal relationship because the solution of remote work, home office, is still being developed, in my opinion. And we have not seen, I think we had it equal or some points, but very likely of a personal, due to a personal effort of adaptation. And not with a structure vision, and not with all the tools and everything. On the other hand, Edson gave various examples, caring for a chronic patient, that this patient can benefit from these evolutions, but I think it's, well, structuring this solution, productivity tends to increase and quality as with that. And migrating to digital platforms that enable much more traceability, predictability, and resources and complementary resources to human capabilities as AI, remote monitorings, etc. So on the interface of support to the teams, I haven't seen any critical issues. It's being equal or even better. And I think this tends to increase considering the maturity we're going to have in the environment of providing services. I'm talking about service providing environment. Before I ask Edson a question, Dr. Oliveira, a question, a viewpoint from somebody who designs a strategic vision of institutions, the impact that this gradual transformation has made to hospital institutions. Do you envisage? Well, actually, a hospital, if you plan building a new hospital from the architect's standpoint in a different way, actually, in which this relationship actually interferes in the very structure as to how the hospital is conceived. I'm not talking about a ward, ICUs, etc. How do we consider the idea that we have a society of the physical structure of the hospital? We reflect a lot upon that. This is part of our strategic vision. The hospital today has virtual elements. So we see a hospital that is increasingly more integrated to society with no walls. So the future institution has no walls. It has a large space for people to be together. So we have patients, caretakers, and other practitioners. And we have elements of education and health, because we have to train all these teams, the labor force, for another model, actually another mental model. So the development arms in terms of organization and capacity building and education, they increase in this vision of the future, because the institutions will have to train part of the skills of those professionals, because the time will be a bit ahead of the traditional models of information. And then another strong pillar is innovation and scientific research. So the patient, in terms of providing services, the patient is part of the process. So we have an interaction on the day-to-day. So when we see this moment of transformation that is quite fast, we will have to gain competence to create, to innovate, and to experiment. In the case of the Osvaldo Cruz Hospital, we have this feature. It is a space of almost 1,000 square meters of innovation. Since it is a more traditional hospital, it's been around for 124 years, the space is outside the hospital. Part of the doctors go there, etc. And the next design and space revision, this environment will be inside. And we make this connection. And the surgeon, they want the resources of virtual reality for their surgical planning. The ER doctor is monitoring a patient. They know the patient will require this, that. And many times the institution will invite patients to come to the institution. They realized clinical signs of deterioration before symptoms were present. In the previous, another motto is the patient needs to be engaged in their own treatment. All this advanced telework, well, what it brings, our healthcare has to encompass that. This is a very broad question, and I'll step back and let some room for the other questions. Perfect. I think it's a message to all our audience that we have no doubt that the structure of conceiving healthcare, even in the viewpoint of architecture of processes, is highly impacted, will be impacted, not only by technology, as Edson mentioned, a lot of technologies, but also based on the reality of remote work in several areas. Edson, a question from the chat for you. How, as industry, so there is a great need to provide technical service and provide medical information, products, innovation for the medical community. During the pandemic, a great part of that had to be transformed into an online appointment. So what has been your experience in this remote work of somebody who works in this line of promoting a clinical product with doctors? How has this been seen? What do you think remains of this virtual relationship, with this mechanism of work with the medical community?
I think one benefit brought about by the pandemic was that it forced 100% of the population in the world to do something at the same time. So if we hadn't experienced the pandemic, certainly we would be having this seminar in person, would have traveled to Sao Paulo, because these were the models that we were using at that time. But the pandemic forced us to find a way to continue with our lives, and that was by embracing the virtual world. And since it was the only way available, everybody embraced it because there was no other way. And I think that, well, in the beginning, it was a very intense adaptation period where we would look at the cup being half empty rather than half full. But of course, the pandemic as a whole brought a lot of harm to our personal lives. But with time, people started seeing the benefits that they could extract from that, where sales representative would travel 100 or 200 kilometers to go to a clinic or a hospital to meet with a doctor, and the doctor was tending to an emergency and could not see him or her. So just as we mentioned about the back office activities, where some days you'll be working from office and most of the days you'll be working from home. I also think that this relationship with doctors, where you have to demonstrate new technologies, that will also adopt a hybrid model. And certainly it will no longer require people to travel to and fro long distances, and the visits are also going to become more frequent, and there will be a higher possibility of establishing good interactions virtually. And even these 200 kilometer long trips, which were quite unproductive in the past, that now they're going to be different, and you're going to use that time to be connected with other customers. So as opposed to what people used to say, that this technology builds a gap between people. If you use it adequately, it actually brings them together. Well, that was an excellent subject. But the subject is great because it's transformative. It's a living subject, and it's quite dynamic. But we have, of course, time constraints because we have to start other talks and other panels. I'd like to thank our audience who is still connected, dedicating their time and attention to listen to these illustrious guests. And I also want to thank Dr. Jose Marcelo and Dr. Edson for their presence, for their explanations. and for this discussion. Since it's about remote work, I want to leave you my virtual regards, not only to you, but also to my audience and the FIS team. Thank you and have a great day. Thank you.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Trying to find my way. Every day, just trying to find my way. Every day.
É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown. Fueled by imagination, alone and with others. Repeating an experiment 1,000 times to have the chance to get it right. Once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science. In everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease. The best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós, da Fena Saúde, temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos, proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos. Realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano. E movimentamos mais de 3% do PIB. Nosso desafio é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues, enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow. Microsoft Cloud for Healthcare, empowering health organizations to deliver better experiences, better insights, and better care. Learn more at aka.ms/cloud4healthcare.
A Pronep Life Care, uma marca do grupo Sodexo, é uma das empresas pioneiras na atenção domiciliar no Brasil. Desde sua fundação, a Pronep Life Care já cuidou de mais de 35 mil vidas e atende em todo o país mais de 2 mil pacientes por dia, atuando no cuidado e atenção às mais variadas necessidades. Tudo feito por uma equipe altamente qualificada e especializada na casa do paciente, de acordo com suas necessidades individuais e com acolhimento e cuidado. A qualidade do nosso atendimento garantiu o reconhecimento da Joint Commission International, JCI, que nos certificou com um selo respeitado mundialmente. Tudo isso para levar ao paciente e sua família qualidade de vida e conforto, sem abrir mão de cuidados médicos de excelência.
A Pronep não deixa faltar nada para minha filha. Eu sou muito bem tratada por eles. A equipe é muito boa, é tudo muito bem engrenadinho. É mais vida para o paciente, mais vida para você.
Pronep, movidos pela vontade de fazer o bem.
Nestes mais de 120 anos de história, entendemos o poder de um diagnóstico preciso e rápido na qualidade dos cuidados com a saúde. Quanto mais conhecimento, melhores são as decisões. E maiores as chances de superar desafios para vidas mais longas e com mais saúde. Por isso que na Roche Diagnóstica investimos tanto em pesquisa para o desenvolvimento de soluções e equipamentos, em pessoas que podem inovar e melhorar processos e serviços, e no compartilhamento deste conhecimento que produzimos para o benefício dos pacientes. Isso é valioso. Como líderes, devemos ter consciência e orgulho do nosso poder de impacto na gestão da saúde no Brasil. De desenvolver o mercado, antecipando necessidades e soluções. Queremos ampliar ainda mais nossas condições de produzir informações relevantes e seguras, viabilizando melhores decisões clínicas, para que as pessoas vivam mais e de maneira mais saudável. É isso que nos move. Possibilitar cada vez mais acesso à melhor medicina de precisão para o maior número de brasileiros.
Seja qual for o seu caminho profissional,
o Senac tem um curso para você aprender fazendo. Você pode começar uma profissão do zero ou seguir nossa trilha de desenvolvimento e se aprimorar cada vez mais na sua carreira. Aprender fazendo é a metodologia exclusiva do Senac, que tem foco na prática e faz toda a diferença na formação dos nossos alunos. Saiba mais sobre ela aqui no site. Depois, continue navegando para escolher seu curso e garantir sua matrícula. Senac. Todas as formas de aprender fazendo.
Developed Protector, Environmental Infection Control. Based on international best practices, so we can assure a clean and safe hospital environment, the Protector Advantage is about people, process, and technology. Through education and management, it achieves expertly trained and motivated frontline cleaning staff committed to their vital role in eradicating hospital-acquired infections. Standard processes detail who is responsible for cleaning which items and areas, and what products and techniques to use. Protector incorporates the latest, most effective, clinically proven cleaning and decontamination innovations from across the planet. And from assessment to auditing to analysis, it works with you to drive additional value from under-pressure financial resources, ensuring patients are kept free from harm so they can go home when they should. Protector, environmental infection control from Sodexo. Your advantage in the fight against hospital-acquired infections.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Comets. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso mercado central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso oásis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Trying to find my way. Every day, just trying to find my way. Every day.
É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história.
I'm gonna break through.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown, fueled by imagination, alone and with others, repeating an experiment 1,000 times to have the chance to get it right, once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science in everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease, the best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós da Fena Saúde temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos. Proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos. Realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano. E movimentamos mais de 3% do PIB. Nosso desafio é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues. enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow. Microsoft Cloud for Healthcare, empowering health organizations to deliver better experiences, better insights, and better care. Learn more at aka.ms/cloud-for-healthcare.
A Pronep Lifecare, uma marca do grupo Sodexo, é uma das empresas pioneiras na atenção domiciliar no Brasil. Desde sua fundação, a Pronep Lifecare já cuidou de mais de 35 mil vidas e atende em todo o país mais de 2.000 pacientes por dia, atuando no cuidado e atenção às mais variadas necessidades. Tudo feito por uma equipe altamente qualificada e especializada na casa do paciente, de acordo com suas necessidades individuais e com acolhimento e cuidado. A qualidade do nosso atendimento garantiu o reconhecimento da Joint Commission International, JCI, que nos certificou com um selo respeitado mundialmente. Tudo isso para levar ao paciente e sua família qualidade de vida e conforto, sem abrir mão de cuidados médicos de excelência.
A Pronep não deixa faltar nada para minha filha. Eu sou muito bem tratada por eles. A equipe é muito boa, é tudo muito bem engrenadinho. É mais vida para o paciente, mais vida para você.
Pronep, movidos pela vontade de fazer o bem.
Nestes mais de 120 anos de história, entendemos o poder de um diagnóstico preciso e rápido na qualidade dos cuidados com a saúde. Quanto mais conhecimento, melhores são as decisões. E maiores as chances de superar desafios para vidas mais longas e com mais saúde. Por isso que na Roche Diagnóstica investimos tanto em pesquisa para o desenvolvimento de soluções e equipamentos, em pessoas que podem inovar e melhorar processos e serviços, e no compartilhamento deste conhecimento que produzimos para o benefício dos pacientes. Isso é valioso. Como líderes, devemos ter consciência e orgulho do nosso poder de impacto na gestão da saúde no Brasil. De desenvolver o mercado, antecipando necessidades e soluções. Queremos ampliar ainda mais nossas condições de produzir informações relevantes e seguras, viabilizando melhores decisões clínicas, para que as pessoas vivam mais e de maneira mais saudável. É isso que nos move. Possibilitar cada vez mais acesso à melhor medicina de precisão para o maior número de brasileiros.
Seja qual for o seu caminho profissional, o Senac tem um curso para você aprender fazendo. Você pode começar uma profissão do zero ou seguir nossa trilha de desenvolvimento e se aprimorar cada vez mais na sua carreira. Aprender fazendo é a metodologia exclusiva do Senac, que tem foco na prática e faz toda a diferença na formação dos nossos alunos. Saiba mais sobre ela aqui no site. Depois, continue navegando para escolher seu curso e garantir sua matrícula. Senac. Todas as formas de aprender fazendo.
Developed Protector, Environmental Infection Control. Based on international best practices, so we can assure a clean and safe hospital environment, the Protector Advantage is about people, process, and technology. Through education and management, it achieves expertly trained and motivated frontline cleaning staff committed to their vital role in eradicating hospital-acquired infections. Standard processes detail who is responsible for cleaning which items and areas and what products and techniques to use. Protector incorporates the latest, most effective, clinically proven cleaning and decontamination innovations from across the planet. And from assessment to auditing to analysis, it works with you to drive additional value from under-pressure financial resources, ensuring patients are kept free from harm so they can go home when they should. Protector, Environmental Infection Control from Sodexo. Your advantage in the fight against hospital-acquired infections.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Comets. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso Mercado Central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso Oasis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Trying to find my way. Every day, just trying to find my way. Every day.
É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história.
I'm gonna break through.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown, fueled by imagination, alone and with others, repeating an experiment 1,000 times to have the chance to get it right, once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science in everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease, the best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós da Fena Saúde temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos, proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos, realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano e movimentamos mais de 3% do PIB. Nosso desafio futuro é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
As Rodrigo Villa has said, let's do it. If you've registered with FISWIC, you can get connected and transform health with us. If you haven't registered yet, please use your mobile phone to the QR code you can see on the screen, click Trust, and just get registered. Importance of research and development in a new industrial complex of healthcare. We have Angela Cohen-Mueller, Director of Technology and Innovation of COP, University of Rio de Janeiro. We have Felipe Barreiro, VP of Medtronic, José Gomes Temporan, former Ministry of Health, Marco Griga, VP of Production and Innovation in Health of Fiocruz, and Marta Dias, President of Pfizer Brazil. Next panel, please. Hello, good afternoon, everyone. Good afternoon to all of those who are here with us. I would like to start by thanking the organizing committee of FIS, especially Josie Villar, for the invitation to be the moderator of this panel. I would also like to thank our panelists who are going to share their experiences and inputs. They've all been introduced to some extent, But let me very briefly say who's who. We have José Gomes Temporão, who is a public health physician. He was Ministry of Health between 2007 2011, a researcher of the Public Health School of Fiocruz, and he is executive director of the Sul-American Institute of Government and Health. Dr. José Gomes Temporão will go first. Unfortunately, he cannot stay till the very end. He has another appointment at 3:15, so he won't be able to be with us till the very end. We also have Dr. Marta Diaz, who has taken different leadership positions through her career. She was the president of the Andean cluster, and she also worked with Sandoz, GE Healthcare, and Boston Consulting Group in Spain. She is currently president of Pfizer in Brazil. We also have Marco Krieger. He is trained in biology science in Paraná. He is master and PhD in the Federal University of Rio de Janeiro, and he is the vice president of production and innovation in health for Fiocruz. We also have Felipe Barreiro. He is an engineer trained at Unicamp. He has his MBA in Foundations Getúlio Vargas, specialized in strategy from the University of Miami, School of Business Administration, and he is the VP of Medtronic Brazil. And finally, myself, I'm Angela Ula. I studied chemical engineering and my master in UFRJ and my PhD in Paris, and I am a professor of technology and innovation at COPI. Before giving the floor to my speakers, I would like to make some comments. We are talking about the importance of R&D in a new complex of health, a very relevant and current topic. We've been speaking a lot about science, technology, innovation. These are buzzwords, and that has been the case during the pandemic. We've said good things and bad things about that. We have taken thousands of years living in the years of darkness, during which religion ruled. It's very sad to see we going back to the obscure days. So all the values of enlightenment, science, and democracy. Science and technology and R&D are indication of civilization and sovereignty and the economic value that R&D brings to us. The pharma industry, its whole basis is R&D. And the pharmaceutical industry is known for its dynamic role in R&D. Global companies invest 15 to 20% of their revenues into R&D. In Brazil, the pharmaceutical industry has had more concentration on the production of generics, and there are some other institutions such as Fiocruz and Butantan, which tend to develop more R&D. And though we have focused on generic, even the API used in generics come from abroad in Brazil. We import medication, vaccine, pharmaceuticals, and in 2019, it represented $8 billion in imports. 80% of our APIs are imported from China and India, and medical and hospital devices in 2017 amounted to $7 billion. During the pandemic, we had a clear understanding of our shortage. We had a problem of PPE, of tests, of respirators, of alcohol-based sanitizers, well, let alone vaccines. Everything was imported, so we lost our autonomy. From an economic perspective, it's worth to invest in a new health complex, which is based on research, development, and innovation. In addition to market size, $15 to $20 billion, a really an impressive market. We also have a scientific tradition in the area. Physicians, engineers, biologists are very well trained, but we have to think of a business modeling, so to speak, to have a new health complex in Brazil. There is something unique about the Brazilian system. In Korea, 80% of researchers work in companies. In Brazil, 70% of researchers are in research centers or the university. Therefore, I have some questions to ask you. Is it enough to be a manufacturer of APIs such as India and China? Is it the model we should follow? Would world company be willing to bring their research centers to Brazil? Can Brazilian companies change their behavior and have more R&D in Brazil? These are the questions that really drives us to discussing the importance of R&D in health industrial complex. Said that, let me now hand it over to Minister Gomes Temporão for his comments. Good afternoon, everyone. Let me greet Professor Angela Uller, Felipe Barreiro, Marco Dria, and Marta Diaz. I would like to greet all of those who are watching us. A very relevant topic, certainly. COVID-19 pandemic has laid bare our technological vulnerability. Brazil was brought to its knee. We had no access to PPE, inputs, respirators. We had some difficulty to access API and start manufacturing vaccines. And Brazil is too big a country to remain in such a fragile position. So I would like to start by just making a diagnosis before coming my proposals. R&D environment is not appropriate in Brazil. There are some critical barriers to production of knowledge and innovation. We've seen a escape of brains because the government attacks Brazilian science and makes it very weak. I never thought I would live to see what I've been witnessing. We know that developing and detaining technological information is absolutely essential for any country that wants to reach full sustainable development. We have observed a lack of strategic understanding and public policies. And as such, we haven't reached the second level of development that we should have. We need a continuous, efficient policy that favors research and development. Some data of the survey of innovation by IBG shows that they are from 2015 to 2017, and there has been a decrease in investments of research and development in the public and private sector. Public expenditures are 0.63% of GDP. Private expenditures are 0.64% from private institutions. We see that some efforts are just focused on getting fiscal incentives and exemptions to buy imported devices, and very little is invested in really coming up with innovation. If we really visit what we have for example, submission of patents, since January last year, we can see that in 2019, 25,000 patents were submitted. Only 20% were patent submissions of people living in Brazil. 40% from research institutes, 20% of small and mid-sized, and 10% of micro companies. In other words, 80% of those submissions were made by non-residents of Brazil. 30% of them of companies or researchers from the US. Brazil has scale and demand. We have a industrial structure, the best one in Latin America. Excellent research institutes and university. The technical quality of our researchers is widely known. We can run clinical trials. We have an internationally respected regulatory agency. We have a universal healthcare system. India and China do not have that. Generics produced by India are not consumed by half of the Indian population. We have universal system, we have access, we have important financial supporting agencies, a number of them currently under the attack of the government. And we have the experience implemented in when I was in office of reducing Brazilian vulnerability in the economic industrial complex, thanks to partnerships which were continued until 2016. Unfortunately, the policy was interrupted and today is a threat. A policy which is coordinated by the Ministry of Health using the power of government. I know Marco Krieger is going to talk about the experience of AstraZeneca vaccine, which is a wonderful initiative that really shows the importance of having this understanding. We've created the executive group of the health industry, which complex, which unfortunately was dissolved by the government. We defined a group of technology, analyzing strategy and the reality, and we have forged partnership between public companies from Brazil and from abroad. We created 80 partnerships in this field, but in 2016, everything was put to a halt. So Brazil has all the conditions to stop being a passive absorber of technology and really become one of the front runners of technology and innovation. But to do that, we need to be more than producers. We have to be among the top group of countries developing knowledge, and we have all the necessary conditions. What we don't have is a long-term policy, something for 20, 30 years that can really take us from the very bad situation we currently find ourselves in. Thank you very much. Thank you very much for your comments. And you stick to your time. Great. Let me now hand it over to Marta Diaz. Thank you. Good afternoon, everyone. Thank you for the invitation to be part of this relevant discussion about research and development and what's essential to improve the health of the Brazilian population. Now, speaking of the last months, our lives have changed so much. COVID-19 pandemic has brought a number of challenges to professional companies, researchers, especially in healthcare. And I would like to acknowledge the work of healthcare professionals. Since the beginning of COVID-19, it has become even more evident the importance of having companies such as Pfizer bring in health innovation to support society at large. At Pfizer, since March 20, we have dedicated all our efforts to bring therapeutic responses that could help us fight the pandemic. As a result of our best efforts in a record time, in partnership with BioTech, we've managed to develop, test, and approve a vaccine of high quality, safe, and accessible that could help us fight COVID-19. This is part of the innovation DNA of Pfizer. The development of molecules that really transform the way we treat disease is the purpose of our history of nearly 70 years in Brazil alone. Making impossible become possible is very hard, but for Pfizer, this is our mission, our daily mission, and our purpose as a company. We have an unprecedented situation with a very promising pipeline with 100 potential innovations that can change the lives of millions of people, in addition to COVID vaccine. Pfizer got very well known as a result of our vaccine, but we have a long history of innovation, and we have changed the way that many diseases have been treated. Pfizer has brought advances in different areas: oncology, internal medicine, rare disease, inflammation, immunology, and hospital area. We have over 150 medications licensed in Brazil. We touch many lives. Today, in the world, 1 in every 7 people has already used a vaccine or a medication by Pfizer. If we consider COVID-19 vaccination, about 100 million people will be impacted by us, almost half of the Brazilian population. We have a very robust structure in Brazil. We have a manufacturing plant in the state of São Paulo focused on manufacturing solid drugs. This year, we announced a partnership with Eurofarm, a Brazilian pharmaceutical company, to produce locally COVID-19 vaccine. It's also located in Itapevi and extending then the supply to 4 continents, including also Africa and South America. It included knowledge transfer, and we've already started our operation. We are expecting for it to start in 2022, and as a result of our operational capacity, we can produce more than 100 million doses of vaccine.
And they are distributed exclusively to Latin America. We also invest in research and development in Brazil, and which became even more evident during the pandemic because we participated in significant global trials, including the trial for the vaccine and also the development of an antiviral for COVID-19. We have many studies going on in the country. Now, as important as developing molecules that can change the course of disease, you also need to work for these innovations to effectively get to new people. And for this reason, we want to lead the dialogue and contribute for the improvement of the healthcare system so that there is better access to healthcare. One of the major accomplishments of the population is the possibility of having access to vaccines and medications through SUS and also through health plans. Access and sustainability depend directly on the assessment of these technologies. So we need to think that this model is a model that provides opportunity for improvement. Thank you very much. I thank you very much for the opportunity. Now, Dr. Marcus Krieger. Well, first of all, I would like to thank the invitation to me. It's an honor to be here sitting on this panel with our renowned colleagues and the former Minister Temporal, who has always been exemplary as a minister, but also as a researcher at Oswaldo Cruz Foundation. I think that we are going through a very important moment with the opportunity of now discussing a learning that needs to be deepened with regards to the development of Brazil and the use of scientific knowledge for the benefit of society. I think that Fiocruz started and has in its DNA 121 years, and to deal with other pandemics that existed in the past, such as yellow fever and others. And our colleagues of 110 years ago could solve those problems. Not only that, but also start a virtuous activity of scientific research in public health, such as the discovery of Dr. Carlos Chagas, which took place in the first decade of last century, which was not the beginning of scientific activity in Brazil, but undoubtedly was the time when Brazilian society saw the benefit of using scientific knowledge to solve its problems. And this is very strong in our activities since then. We went through many other situations, just to mention. Over the last few years, we had, and Dr. Temporão will remember, we had H1N1 outbreak while he was a minister, which was a challenge for our healthcare system, and other emergencies such as Zika virus, re-emerging such as yellow fever and measles, and the new sanitary challenge that we have had with SARS-CoV-2. I think that our generation has had to deal with the biggest public health challenge of the last 100 years, at least. And our challenge has come to a moment that maybe we're not so well prepared as humanity to deal with this challenge. I think that we have had very significant accomplishments, such as, for example, AIDS virus took 3 years to be identified. It took 3 years before they identified the virus as the cause of AIDS. The first outbreak of coronavirus earlier this century took almost 1 month to identify SARS-CoV-2. In one day, we already had the genome, and in 1 month, we were trying to design the first vaccines. And in much less time than it was necessary to identify the virus that caused AIDS, we already had many candidate vaccines already in the clinical phase. And this is important to show that the scientific knowledge is available. And I think that the Brazilian society and the global society as a whole has been using society as the best way to deal with the pandemic. Of course, we see anti-science movements, but in Brazil, at least with regards to vaccines, it's much less significant than it is in other countries. Here, we have a compliance of more than 90% of the population. I would like to say, first of all, is that these movements didn't happen in the middle of nothing. The new vaccines that we are using now, they were being developed already to face sanitary challenges. There were significant challenges for the funding and preparation for a new pandemic of an X disease, which we didn't know what it would be, but we were kind of expecting it. And also we were funding the technologies such as Moderna's technology were also being developed for this type of initiative. And immunotherapy had transcended the field of infecto-contagious diseases and was being widely used in cancer, in autoimmune diseases, such as the case of the history of the vaccine of Pfizer-BioNTech, and you had the pipeline that was much more significant for cancer and new diseases rather than infecto-contagious diseases. But that knowledge for this new technology basis for immunotherapy made it possible for them to provide a very prompt response. It's very important for us to assess that right now in Brazil, we have a funding crisis of the funding system for our system of technology and innovation, and this is may be related to other challenges. And I would take the freedom to draw your attention to the results we have attained, the long history of the country with investments in different areas of research in Brazil. The investment made at Embrapa has transformed the country, maybe the most significant country in terms of production of food in the world. The investments made on ITA in space engineering school made it possible for us to have Embraer, maybe one of the leading companies in this industry in the world. And I'm sure that the investments made in health and public health, the investments made after the policy of the Ministry of Health, and we have the honor of having Minister Temporão, that was related to the foundation. I'll share a brief story with you. It started as a program in the post-graduation of the City School of Public Health, and we started discussing the transformation of health and turning it from expense into investment. So the rational use of funds that needs to be invested in health into a platform for development and innovation. I think that innovation needs to be seen without any limitations. It's an important model for science and technology, so long as they are prepared to develop new products, just as to support internal products. In the situation we are dealing with now, I think that the legacy that we have, and in closing, is that today we would be backed up by society with regards to the use of scientific knowledge for the benefit, especially in the field of health. This is very well consolidated. And I think that the example of the dependence that we had at several moments in dealing with a pandemic, in the personal protection equipment, PPE, and diagnostic tests, inputs for vaccines. So all this difficulty reinforces a vision of strategic position of a few segments in the country. It's impossible for us to be isolated in a bubble, thinking that we must do everything in Brazil, but we need to focus on certain strategic materials that should be produced. In the case of vaccines, today we have more vaccines, but for different reasons. There was major competition. Not all countries have the same number of vaccines that we are having, and neither did us. It's important to emphasize in the first half of the year, we were almost 90% dependent on the vaccines produced by Butantan and Fiocruz. And strategically, it needs to be defined and focusing on inputs that are important for a country that is very big with high populational density and a health system such as ours. I think that this discussion is very important, and we started an event such as this, and we are going to keep it over the next few months and years, always trying to retain the lessons learned from the pandemic. Thank you very much, Marco. Well, this has been a very nice chat. Felipe, please. Thank you very much. Good afternoon. And I would like to introduce to you Medtronic. Medtronic, so well known as Pfizer and Fiocruz. Our company is focused on technology for healthcare, especially for surgery, intensive care, diabetes, pain control. It's a company that has more than 200,000 products and treatments for more than 70 conditions and diseases. It's a global company. In Brazil this year, we are celebrating our 50th anniversary. And one of the products that we offer is a mechanical ventilation that was so necessary during the pandemic. So we had an epicenter of all discussions related to the need of solutions, agreeing with what Krieger said in terms of PPE, but also products that have saved lives. And we tried to define the priorities to make the national market well supplied in a situation when we depend from imports. And this is related to the agenda of this conversation. I took the leadership of Medtronic a year ago in Brazil. I have been in a company for 10 years in different positions, and I had the chance of witnessing the evolution of the pandemic and ventilators being allocated to hospitals in order to best supply them, in spite of all the challenges we had to deal with both in Brazil and in the world. In terms of research and development, there's some important information. I'm an engineer, and the Ministry of Economy has reallocated approximately 700 million BRL, a supplemental credit originally meant for the Ministry of Science, Technology and Innovation, to another 6 ministries. So this is one piece of information. Other priorities, without saying if the priority of resources, but in fact 700 million BRL, talking about resources and incentives, it's less 700 million BRL in the Ministry of Science, Technology, and Innovation. 600 were for funding scholarships, projects of scientific research, and this went down to 650 to 90 million BRL. We Brazilians are very much used because of the circumstances to do the best, to work with very flexibility, to be very involved. But obviously, these restrictions impose significant limitations to our capacity of developing good practices. Krieger also talked about companies that are a part of the Brazilian pride, such as Embrapa, Embraer, Fiocruz, Butantan. Brazilians are proud of that. I think that they are part of universal healthcare system, the biggest in the planet, by far the biggest healthcare system in the country. But once again, funding in healthcare as a whole imposes severe restrictions to our possibility of providing quality on the front end to the patients, and obviously thinking of the chain as a whole, the whole path from the development of technologies, researchers, all the way to the creation and assembly and design of products that will effectively improve medical practices. The reduction of the budget of the Ministry of Innovation, Technology and Science was down by 50%. If we between 14 and 18, it was 11.5 billion BRL, and today is about 2 billion BRL. So, in spite of all the difficulties, we are the 13th in terms of scientific production in the world. Talking about all the areas, we have more than 372 papers published internationally in the past 5 years, from 15 to 20. So this equivalent to 3% of the scientific production in the globe in the same period, in the past 5 years. I think that this reinforces and backs up the issue of the skill of Brazilians. And I was talking earlier on about our skill and our potential capacity in the Brazilian territory to have a production which is above average in spite of all difficulties. Another important information, the state of São Paulo concentrates is the biggest concentration of scientific and technological production. 70% of the expenses in research and development are centered in the state of São Paulo. So I also see an opportunity of us disseminating and having a better balance in other states of the Federation, universities, to have scientific hubs that can produce a lot to support our long journey.
The ministry talked about our lost brains to foreign centers, and this is a constant concern of us. In the academia, there is a very clear pressure in terms of resource distribution, and Brazil is not characterized as a country that historically has a high loss of brains, and this is something said by Renato Giannini Ribeiro. But recently, we've been observing more talents being lost to other centers. In my opinion, I think we have a very long journey ahead. Medtronic can contribute significantly, and as a patriot, I think we can have a more sustainable system in Brazil that encourages technological innovation and development of new practices, the development of the country as a whole. And I also see my optimistic side, which looks forward to having a more promising future. Considering everything that we've learned as a consequence of the pandemic that has hit all of us very heavily. Of course, we are learning many lessons from our experience, priority in health. There has been an increase in healthcare plans, more accessible ones. And there is a clear understanding that the population wants to have healthcare of quality, regardless of being private or public. But we really have to take the best of this moment to leverage this agenda and be able really to evolve in our understanding. Having really an industrial complex where we can actually reach sovereignty. There is a dependency on external technology. There is more in terms of production line. Marta developed her whole career in the pharma industry, so has mine. And manufacturing in Brazil is not characterized by production of supplies, but rather by its consumption. In medical and the supply area, we just combine supplies. We are more characterized as a industrial line, a setup line, and this is why we depend on raw material and supplies coming from abroad. So it would be wonderful if we could really have it done in-house. Great, thank you, Felipe. I would like to make some comments. We think that Brazil is going to work fine, and now and then we seem to go backward now and then. But I would like to give you an example of what we have. And we can have successful things. One of them, oil and gas, for example. Petrobras has really beaten all technological things, and then we learned all this progression, and this is almost a successful case. How much university has evolved into that? There are many people who believe that in the university we can develop everything, but that's not true. We can study, we can propose, we can research, but then we need a company because universities do not sell anything. In the pharma industry, companies in Brazil do not like to run risk. Just to give you an idea, we run preclinical data, things that we're trying to go into phase 1, phase 2, but we don't see any company willing to invest, even knowing that we have public funds that we have come up with, something from the Ministry of Science and Technology, but it's really difficult to have that kind of experience. There are some other observations because there is here a question by Mauro Pakanovsky, who says, why can't we use different public labs to develop research and development? Would you like to answer that, Minister Temporão? Yes. Well, I don't think that it is the mission of public labs to run research and science. Brazil is an exception in the global context. We have a significant network of public laboratories, mainly Fiocruz, Butantan, Ezequiel Dias, Tecpar in Paraná, LAFEP in Pernambuco, Institute Vital Brazil in Rio, and they started their mission by manufacturing medications, commodities, so to speak, for public health programs for the previous campaigns of the Ministry of Health for malaria, TB, and they've lost somewhat the sense of its existence. With the PDP policies, we tried to reset the context. In the one side, it made no sense to produce medications which are widely manufactured and sold by different products or industries in the market, but it makes sense to act in attack niches such as neglected diseases or areas that the company believes to be strategic. This is how it has happened in vaccines, for example. For the past decades, Brazil, differently from all other Latin American countries which closed their public productions of immunobiologicals, Brazil just bet exactly on the opposite. Brazil invested heavily on structuring a technological productive basis. And this has been the base that provided us the best situation for COVID-19. So you see, Marcos Krieger and Nisia Trindade were wonderful in working with AstraZeneca through an innovation in public procurement. It was a technological agreement that means that Fiocruz now has mastered an important technology to develop also future vaccines. So this is the role of public labs. I don't think it should be competing with the university or with those that are producing medication to the market. I think it should be part of a strategic understanding of the government. And the best demonstration that it can succeed is the example of Fiocruz for generics to control AIDS. Brazil has been a pioneer in providing medication for AIDS and in vaccines, as Fiocruz and Butantan have been shown us. I would like to ask a question to Marta. The example of AstraZeneca and Oxford is a successful example. Do you believe that it would be possible? Would it be possible to have a partnership like that between a Brazilian university and Pfizer? I think that the future is in the hands of partnerships as a whole. They are very important for the development of research. And you said that research can never be done alone. One university cannot do it alone, and a company alone cannot either. And Pfizer has contributed with many universities throughout the world, and also with BioNTech, for example. These are the partnerships that really ensure greater success. So I can see a partnership with Pfizer and university, as we have already had in other places of the world. I don't think it's something impossible, quite to the contrary, something really feasible. And partnership with private companies, as we have just done with Europharma. Different companies have different strengths and capabilities. This combination of a company such as Pfizer that has COVID vaccine can produce it. Europharma has a well-respected, known a company with high quality. So bringing together these strengths of different companies, either private or public, we can just do the best science. Former minister has mentioned that there is also legislation. We should have respect for innovation and have the appropriate environment that would provide conditions for long-term innovation. Innovation doesn't happen overnight. We've heard that COVID vaccines, they just managed to be produced so quickly because there had been research for a long time. So we should have industries that respect innovation, respect patents. Brazil is a huge country with a very large market, with the public healthcare system, which is the largest in the world, but it should also offer conditions for innovation. There should be no incompatibility. We should have innovation, technology, and also provide access. There is no question from the public, but I do have a question myself. Brazil is a country full of bureaucracy. Public and private organizations tend to have to meet a number of requirements. We do have good legal framework, but concerning science and technology, but we do have a number of other difficulties, red tape, and some uncertainty, and no investments by the government, in addition to inconsistency in policies. It impacts public and private companies likewise. So I would like to hear from you, what do you think would really help us attract more business here in Brazil? Let me start with Michael Krieger, who does things here in Brazil, but I'm sure he's impacted by all of that. And Felipe, who does think, but import things to do things here. Well, we have a number of challenges to do it in Brazil. Our legislation of science and technology is really important, but if we look to the most innovative countries in the world, they do not have any specific legislation because they don't need to. You don't have to really have any specific procurement process to buy things. Of course, everything is important, but we have to have a clear understanding and models in the process. We really have to realize there are difficulties, and we have moved ahead. Minister Temporão mentioned the example of that we had of development of technology. It was a decision based on risk assessment, but at that time, we had to make a decision to invest in products that did not exist, regardless of what product it was. The Brazilian legislation does not allow the preparation of production and manufacturing of a product that does not exist yet. But we carried out a risk analysis of not making the technology investment and how it would be if we hadn't started in March last year to discuss that. Despite all difficulties, it was still very important to rely on this tool and this disposition of our law. And it really is showing us that we have excellent legislation, but the only thing is, how can we convince everyone in our country, especially now when we have so much uncertainty going on? Civil servants, for example, are not sure about really making a purchase of anything innovative. When I am in meetings with managers and innovators, I say, who is in favor of buying 600,000 without having a formal RFI or a bidding process? So all researchers say, yes, we are. The other managers say, no, definitely not. So we really have to make sure that the risks have to be run, provided that we have technical scientific conditions to really support the projects as they deserve to. At Fiocruz, we have been encouraging innovation, and we are trying to assess projects on and not how money is being spent, but how can we achieve goals, objectives. Because sometimes there is a good project, very well assessed, but nobody knows whether that study has been published in a good peer review journal, and if it has produced good results or not. I think we really have to fine-tune that. But I really have to say that Fiocruz has been selected to be a center of innovation for next generation vaccines, RNA-based vaccines. And this has all been based on an internal project that we had carried out. Our diagnostic test is also resultant from a project that was funded by our innovation fund. I should have talked about oil and gas, which was, it's probably the best example in science and technology, but I am absolutely sure that this is what we have to do. The problem is, during this political economic crisis that we've been experiencing, it's we really have to do whatever it takes to emerge stronger from the difficulties we've been subject to. When you were speaking about the legislation, maybe Marta won't understand that, but the problem is not really the top management, but it's really sometimes the middle level, you know, it's complex. Felipe, well, my vision is along the same lines as Krieger. I wouldn't like to repeat his ideas, but let me highlight some important issues. I see progress in some specific areas. ANS, Anvisa, Conitec, I can see they have faster processes now. They have more transparent processes of analysis. Anvisa, our health regulatory agency, some technologies that would take 24 years to be approved now can be 24 months to be approved, now can be done within less than 1 year. This is one of the characteristics in Brazil which are necessary to reduce bureaucracy. It should keep up with ethics and transparency and compliance. Really an environment that can bring transparency, because investments have to be aligned with certainty that the funds are being invested as they are expected to. I can see some areas where we have been managed to advance significantly. However, in terms of research and development, still have got something to do. We've got our homework, maybe best practices to be replicated in this area. Uncertainties, volatility. In any aspect of public policy, go against the interest of investments. Investments in research, innovation, in manufacturing plants, they are long-term investments. And as such, for multinational companies to make investments, to attract their interest, the long-term policies have to be enforced and stable. And finally, costs. Brazil. Tax rate is high compared to other countries. Our competitors to attract research and development and manufacturing. So financial part, and Krieger was talking about managers who are not willing to make investments at lower levels, but each invested dollar has an impact on the return on investments. In other words, we still have got a very high costs in Brazil. And this is why we always have to make sure before making investments. Well, I think we have come up to the end of our panel. I would like to thank you all very much for your participation. And I hope politicians have heard the messages we've shared with them. It should be the engagement of everyone, private companies, public companies, research centers, university. We have to work together. Thank you all very much for your inputs. No further questions were sent to us. And I wish you a great afternoon. Thank you. Have a great afternoon. Thank you.
A Abrange completa seus 55 anos de caminhada com o propósito de democratizar o acesso ao sistema privado de saúde, de eficiência e qualidade. Enxergamos o futuro com bons olhos, mas sempre priorizando o presente. Abrange 55 anos. Nossa origem, nossas histórias e nossas conquistas.
Desde que a Covid-19 chegou ao Brasil, uma força-tarefa de proporção histórica entrou em ação, ampliando a parceria entre os setores de saúde privado e público. Um conceito central para nós ganhou ainda mais força. A saúde brasileira é uma só. É um orgulho fazer parte dessa corrente. ANAP, Associação Nacional de Hospitais Privados, unidos pela saúde.
O conhecimento transforma. A transformação te carrega para o futuro.
Onde você quer estar daqui a alguns anos? Qual habilidade você quer aprimorar? Que profissional de saúde você deseja ser? Como caminhar de mãos dadas com o seu futuro? As respostas de todas estas perguntas não se alcança sozinho. Ask Mind, porque nós somos incansáveis por conhecimento. E você?
A Bradesco Saúde desenvolveu uma série de iniciativas que promovem orientação e cuidado em meio à pandemia de Covid-19. É o Saúde Digital. Com ele, quem tem Bradesco Saúde pode realizar consultas médicas por videochamada sem sair de casa. Veja como funciona. Para dúvidas e sintomas de Covid-19 ou outras questões de saúde, você deverá acessar o app Bradesco Saúde. Se você ainda não tem instalado, faça o download gratuito na App Store ou no Google Play. Para consultas médicas regulares com médicos referenciados, acesse o site bradescosaude.com.br. Confira as especialidades disponíveis para atendimento por videochamada e como agendar sua consulta. Bradesco Saúde, ao seu lado contra o coronavírus.
É pra ficar junto.
Inspira.
É pra saber sua história. É pro seu estilo de vida. É pra olhar nos olhos. É pra cada fase da vida. A DASA é uma rede de saúde integrada que acompanha as pessoas ao longo da vida. DASA é pra toda a vida.
Para ser referência em medicina, é preciso ir além. É preciso ciência, método de pesquisa, fomentar conhecimento, compartilhar e formar talentos. Ao longo do tempo, investimos para termos o melhor corpo médico, as melhores instalações, a melhor equipe assistencial, a tecnologia mais avançada. É nisso que acreditamos. É isso que buscamos. Somos o Hospital Moinhos de Vento. Referência em medicina, referência em saúde.
The body is an amazing organism, designed to run marathons, think of ideas, and see a beautiful world. It's capable of complex tasks. But when the body is compromised by disease or disorders, disabled by trauma or wounds, it needs help getting better. And that's why we're here, to create medical technology that saves lives and changes lives. For the heart, the soul, the ambitions, and the dreams of every person we touch. We are here to innovate, to look at challenges from all angles, to follow patients beyond diagnosis, through treatment and recovery, to get them back to their best body, living their best lives, and being their best selves. Our ambitions are big. We are working to give people surgery without incisions, contact lenses that treat allergies, implants that monitor themselves, real-time maps of the heart. We are redefining what the body can accomplish. And even though we are a diverse group of businesses, we share a common goal: save lives and ignite all that's possible in everybody.
Super-heróis são seres com poderes mágicos que voam, que enxergam o que ninguém enxerga. Hoje, fica claro que vivemos rodeados de super-heróis, dirigindo, acolhendo, cuidando, que têm feito da proteção do outro sua missão. Eles sempre estiveram aqui, só estavam disfarçados. Homenagem a quem tem feito mais do que seu trabalho para mais gente ficar bem. Mater Dei 40 anos.
Em 2021, o prontuário eletrônico do paciente do SOMV, solução da empresa para o setor hospitalar, ganhou pela 6ª vez consecutiva o reconhecimento de melhor da América Latina, de acordo com o Instituto Norte-Americano CLES. Uma vitória que é nossa, de cada um que trabalha na MV. Quem faz o PEP sabe que por trás da solução tem muito esforço, dedicação e comprometimento. É por isso que esta conquista não é apenas da MV, é do Brasil, é nossa.
Nós nascemos na saúde e nos movemos pela saúde. Impulsionados por essa paixão, nos tornamos uma das maiores empresas de tecnologia para a saúde do Brasil. Nosso caminho é trilhado por 400 colaboradores e mais de 6.000 clientes. Somos tecnologia que evolui todos os dias. Somos Fixion.
Inspirar pessoas a cuidar de pessoas. Isso está conectado no olhar e no sorriso de quem é Sabin. De norte a sul do país, o jeito Sabin conecta você ao que existe de melhor em saúde integrada. Construímos pontes e histórias para contribuir com a comunidade, o meio ambiente e com um ecossistema empresarial mais humano, diverso e inclusivo. Seja aqui na sua casa ou na nossa casa, estamos de mãos dadas com a inovação e tecnologia para que a sua jornada de saúde seja completa. Grupo Sabin, presente e futuro conectados com a sua saúde.
Nascemos com o desafio de mudar o olhar para a saúde de cada pessoa, transformando informação em conhecimento. Tudo em um mesmo lugar, dados e serviços juntos para permitir pela primeira vez que cada um tenha a visão completa sobre sua saúde. Todos reunidos em uma plataforma, unindo forças para criar soluções extraordinárias e oferecer todo o cuidado que cada pessoa merece e precisa, de maneira coordenada e digital. Afinal, acreditamos que usar a tecnologia de forma inteligente e integrada é o primeiro passo para preservar o maior ativo de nossas vidas, a saúde. ID. Toda saúde é única.
CHB é uma das maiores consultorias em saúde, benefícios, seguros, resseguros e affinity. Com foco em inovação e proximidade com o cliente, a THB tem uma equipe multidisciplinar, com consultores especialistas na estruturação e administração de programas customizados. Fundada em 1978, faz parte do grupo MODELOS, o maior wholesale broker dos Estados Unidos, e está presente em todo o Brasil. THB, soluções que vão além do seguro.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Commits. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso Mercado Central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso oásis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
A Abrange completa seus 55 anos de caminhada com o propósito de democratizar o acesso ao sistema privado de saúde, de eficiência e qualidade. Enxergamos o futuro com bons olhos, mas sempre priorizando o presente. Abrange 55 anos. Nossa origem, nossas histórias e nossas conquistas.
Desde que a Covid-19 chegou ao Brasil, uma força-tarefa de proporção histórica entrou em ação, ampliando a parceria entre os setores de saúde privado e público. Um conceito central para nós ganhou ainda mais força: a saúde brasileira é uma só. É um orgulho fazer parte dessa corrente. ANAP, Associação Nacional de Hospitais Privados, unidos pela saúde.
O conhecimento transforma. A transformação te carrega para o futuro. Onde você quer estar daqui a alguns anos? Qual habilidade você quer aprimorar? Que profissional de saúde você deseja ser? Como caminhar de mãos dadas com o seu futuro? As respostas de todas estas perguntas não se alcança sozinho. Ask Mind, porque nós somos incansáveis por conhecimento. E você?
Hello, everyone. We are back. Today, we wanted to remind you that we will now have 2 FIS weeks per year, one in May and another in November. In May, we will have 4 events. The Innova Summit, which is the greatest innovation event in the health sector in Latin America, which you already know, and ComMeets, which we have introduced in this edition of FIS Week. We will also have 2 additional events, Fiesta Summit, that will talk about marketing and the patient experience and also user experience, and Liga, which is focused on education. Yes, that's great. There's a lot to come. The FIS initiative is flying. So now let's have our next panel. Today, we're going to talk about building a collaborative model in the health sector in Latin America. As a moderator, we have Mr. Ari Ribeiro, who's CEO of the Children's Hospital Sabará, and participants will be the following leaders: Mr. Eduardo Bianco, who is a cardiologist and founder and former president of CIET, Mr. José Luis Castro, who is a president and CEO at Vital Strategies, and Mr. Luiz Henrique Mandetta, who's former health ministry in Brazil. Okay, let's watch this. Hello, good afternoon to all of you. It is a pleasure and an honor to be here participating in this event FIS 21. First of all, I would like to thank the organizer. I would like to thank Rodrigo for the invitation to be here today as a moderator in this panel. It's an honor to be here as a moderator with the participation of such important leaders such as Eduardo Bianco, José Luis Castro, and former Minister Mandetta. As already mentioned, the topic of this panel is building a collaborative model in the health sector in Latin America. And when we decided on the topic for this panel, the idea was to find a common ground. So the goal was to discuss a collaborative model that was converging. I believe that the greatest challenge we have faced, and we are still facing, of course, is the pandemic, the COVID-19 pandemic. And I think it's very timely that we talk about a collaborative model right now. I guess we will all agree that one of the greatest lessons we've learned so far with the pandemic, with the COVID-19 pandemic, is the importance of collaboration. Whether this is collaboration between different countries, collaboration between different government organizations or NGOs, and most of all, collaboration between individuals. And we've seen many, many examples that, at least for me personally, led me to believe in people, in mankind, looking at all the examples of collaboration and empathy that we've seen throughout the last few months. So we propose that this panel about a collaborative model is precisely about the pandemic. And in the structure of this panel, and in a moment, I will explain how the dynamics of this panel will be. I will pose a question, and the goal or the suggestion is that each one of our panelists, and I'm going to call you in random order, and each one of you will have 10 minutes to make your presentation or / answer to the question that I'll pose. And after these 10 minutes for each one of you, we will have the remaining minutes for a debate, a Q&A amongst ourselves, and also to respond to questions from our audience. And I'd like to take this opportunity to thank all of you who are here watching, dedicating our time to watch this panel. Although we are, of course, still undergoing a pandemic, I believe we now can and should be looking at a future in which we will be able to make a transition from a pandemic into an endemic situation. Considering the lessons learned with the pandemic, with the COVID-19 pandemic, how do you believe, the three of you, how could we better articulate in Latin America, considering a Latin American perspective, how could we think about a collaborative model that would help us to face this endemic COVID situation? We will go into both, considering its direct consequences. So the direct consequences of an endemic situation, as well as those that are related to what we could call the liability or the consequences of the epidemics, both from a social perspective as well as in a health perspective. connected to what we've seen, as the impacts of the pandemic itself. We have issues such as the post-COVID syndrome, and also, what happened in several health systems around the world, in which we saw many health treatments being postponed, and that's what I call a liability, a health liability that we now have in our hands in many countries. So taking into account my preamble, I have the following question. How can we better face and develop a better collaborative model considering this transition period from a pandemic to an endemic, and also considering the health liabilities that we have? And I just like to refer or ask Mr. José Luis Castro to be the first one to have the 10 minutes. Then we are going to have Eduardo Bianco, and then former Minister Mandetta. Thank you very much. Mr. Castro, you have the floor. I'd like to thank the FIS initiative, Mr. Ari Ribeiro, Mr. Eduardo Bianco, and Minister Mandetta. It's an honor to be here with all of you. In March 11th, 2020, the WHO declared COVID-19 to be a pandemic. This was a changing point for public health. And in future decades, we will think about our work as before or after COVID, and how COVID changed our lives, our societies, the economy, and most of our health systems. COVID-19 has taken 1.5 million lives in Latin America. And this is a conservative figure. We've learned in the last 2 years a lot. I think that the most important lesson is that we should invest in strengthening public health and public health systems. When I talk about public health, it's not just about the number of canes or vaccination campaigns. Every time we cross a street in safety, or we can go to a restaurant where it's smoking free, or we have a flu vaccine, we are benefiting from decades of works that have been conducted by public health professionals. Public health is a network of protection that is invisible as long as it works. And we've seen this throughout the COVID-19 pandemic. What happens when we have a support to public health, and what happens when there's no support to public health? In some countries and in some Latin American cities, we had strong leadership and we had fast response, evidence-based, and this managed to keep a lower number of hospitalizations and deaths. In other places, the polarization of science and of measures to control the disease have led to a great number of sick people and deaths that could have been avoided. The importance of coordinating actions became very clear. In Brazil, we acknowledged the central role played by the National Consortium of the State Departments of Health, CONAS, is the acronym, in coordinating the response of different states to this crisis, and we support them. In the beginning of the pandemic, when the real number of transmission was being questioned by the general public, Vital Strategies and CONAS developed together the first national table of mortality rates. Recently, we've developed a tool to visualize dates about symptom, which comes from social media platforms, and this can bring earlier precocious alerts to health authorities when there is a surge in cases. We've also developed the first national campaign of communication with CONAS and other partners, such as the National Front of Mayors and the Consortium of Health Departments in cities and different municipalities, CONASEM. Almost 2 years after we began to face this global challenge, we need to go on working to face the challenges to come. An important factor is how serious we're going to think about COVID in the future. How many hospitalizations and transmissions this disease will cause, and can our system manage this load? Just like the flu season has become part of our life, it is possible that we will face other respiratory viruses every year. That would mean vaccines so that we decrease the severity of these diseases and other social behavioral measures. In this setting, the health systems and the data systems, they are essential. We need data to track new infections and to be prepared to future crises. We should work in collaboration. We need not only to increase solidarity and collaboration in Latin America, but also imagine solidarity at a global level. Our work is based in the idea that building strong public health systems would allow for a greater quality life for all citizens, mostly for those that are at higher risk of mortality or early death. The public health system should be seen as a boat that will carry us through a river. And if this boat has a huge hole in it and it's making water, we cannot fix the boat when it's at the river. We have to fix this hole. It's before that. When it's at the shipyard. And we have to show the creative work of architect Louis Kahn. He was responsible for designing some of the most important buildings in the 20th century. But the National Assembly of Bangladesh is probably his masterpiece. The focus of this architect was to design a design, and this changed completely in the 50s after he visited the ruins of ancient structures in Italy and in Greece and in Egypt. He wanted to rethink about his work free from architectural dogma. So he went back to the basic. From a sound foundation, he produced a gem of architecture in the world. Vital Strategies is also deeply analyzing public health around us and how we can be transformative. Recently, we have invited our colleagues and partners and the general public to reimagine public health. This will be developed in the basic pillars of public health, which are prevention, equality, and communication. Most of all, the collaboration with communities, with social service organizations and all different sectors and at different levels of government. The unnecessary losses we face with the pandemic and the inequalities we've seen have opened the eyes of millions of people to the importance of public health. Millions of people are restless or are sick because they were left unprotected and vulnerable. Reimagine Public Health invites us to show how public health is deeply connected into our everyday life so that the general audience see the immediate and real value of public health, so that people understand that good health, it's not just a question of drugs, medications, or hospitals. It means avoiding diseases and having this care. It means investing in systems of health services, creating data systems that are sound, to guide decisions about health, and making sure that commercial interests are in second place, and in first place we have public interest. It also means conducting regular exams and tests for diseases such as high blood pressure, high cholesterol levels, and cancers, curable cancers. It means rethinking our tax system and reducing the consumption of tobacco and alcohol and ultra-processed foods. Reducing the sources of atmosphere contamination. It means think about the impact of climate change, everything people do to be more healthy. That's why Vital Strategies, we work in these key topics. Here in Brazil, we have been working with local partners and governments to support a better health. Just like Anas, who was at the forefront of the response to COVID-19 through our data program for health, it's a pleasure to have been working with the Ministry of Health in Brazil and with the city of Salvador, Natal, and Belo Horizonte to improve the quality of data about the causes of death in these cities and states. Through our program for safety, we have worked together with leaders in cities such as Fortaleza, Campinas, São Paulo, Salvador, and Recife, and with the state of São Paulo to reduce the number of deaths and accidents in highways and to promote active and safe mobility. Through these efforts, we decreased by 47% the number of deaths by traffic accidents between 2014 and 2019. And now we have become leaders in developing bicycle ways. We also work to support a more healthy feeding habits. We've supported campaigns and media, and we are making an effort to have clear label and food products that make people aware of when food is rich in fat and salt or in sugar. This is also key for public health. More than half of the world population is living in urban areas, so cities are in a unique position to transform the fight against the main causes of death, diseases, and lesions. Changing urban scenarios is key. This could be done through preventing transmittable diseases or non-transmittable diseases such as cardiac diseases, or making an effort to have safer highways for all users. Through our Alliance for Health Cities, 70 cities around the world are working with vital strategies. We are coordinating local and global leaders and also the governments in different cities. We collaborate to support the progress in areas such as infrastructure and transportation, coordinating with the media and also with enforcement authorities. In March 2020, this alliance offered immediate support to help cities respond to COVID-19. This work to respond to COVID-19 is about technical and finance support and also practical resources, focusing on the challenges faced by each specific city, maintaining the services and looking at communication issues to talk about risks, providing legal guidance about measures that could protect health and safety. And finally, regarding the climate conference in Glasgow, I wanted to finalize by giving a reflection about the climate and its deep connection with health. Health must be a central element in the climate policy. Health should and must be part of reductions of emissions and in climate actions. Public health should be aligned with the climate agenda and should collaborate with those that are working to prevent the climate disaster. The consequences for health of the climate change and the economic cost can be much higher than those that we've seen during the COVID pandemic. This is nothing that any industry could solve by itself alone. To better rebuild and reconstruct, there's a lot to be done. We cannot allow that public health is underestimated. This will take time, but we can build the solutions to these challenges brick by brick. This is also a multi-sectorial, interconnected, and collaborative focus in terms of public health. I'd like to take this opportunity to invite you to join Vital Strategies in mobilizing to acknowledge the importance and relevance of public health in our everyday lives, to reestablish the trust in institutions and in the people who are working so that our communities are more healthy and safe. Thank you very much for this invitation.
Thank you. Thank you very much. Let me now hand it over to Eduardo. Please, Eduardo, to tell us about the collaborative model considering the situation of endemic, so from pandemic to endemic in Latin America. Thank you very much for the invitation to be part of this panel. I had prepared a brief presentation in terms of cooperation and healthcare, especially for COVID-19. But I will just guide to the focus you have asked me to present, which is not going to be much different from what José Luis has just said. I'm going to share with you my personal experience and the approach of a problem through healthcare cooperation, primarily smoking control policies, so that other people, other professionals in healthcare can also get engaged in cooperation initiatives to improve the health of everyone, including the pandemic. The topic that I will continuously relate to COVID-19 shows that there is a correlation between COVID-19 and smoking. Smoking kills 8 million people every year, and it's the main cause which is preventable of a preventable disease that can prevent deaths. And we know that there is a 50% increase in severe cases of COVID-19 if the person is a smoker. That worsens the outcomes. So these are non-communicable diseases that really increase the susceptibility of those people if they get infected by COVID-19. So we have non-communicable, communicable disease, we have smoking and COVID-19. Let's speak as a regular cardiologist, even though I'm not in clinical practice anymore. But since the 90s, I had started thinking about cardiovascular prevention, and I decided to go into smoke cessation, really supporting my patients. The center where I used to be an intensivist cardiologist asked me to develop a program. And in 1998, I traveled abroad to get trained. And this is something that really connected me with this world of other initiatives, the cooperation of healthcare professionals that gather information as they go. It's something absolutely essential. Because of the connections, I got associated with the Inter-American Foundation of the Heart, which asked me to work also with this topic in the region. So I started doing so. The following year, I participated in Spain in a Ibero-American Congress for Smoking and Health. I was a clinician helping my patients, but I really realized the importance of public health policies to address health topics. There, I also learned how the tobacco industry had been hiding information to really protect its business. So this is the importance of public policies, not only individualized treatment of people, but rather the development of public policies. It has helped me realize that WHO was also launching the first public health pact, including the control of smoking. And this is something that I would like to emphasize. Now we are discussing about a, let's say, a pandemic preparedness consortium of different countries. And in this Congress in Spain, I also learned that Latin America is where we had the highest prevalence of smoking and fewer appropriate smoking control policies. So it really motivated me to go back to my country and to really dedicate on doing that. So we prepared a letter, and many professionals signed, and we submitted that to the government to really forcing them or driving them to do something concerning that. And this is absolutely essential. National medical associations have to get engaged in topics such as this. So we created a committee of smoke cessation, and we started to run a number of national initiatives. The following year, I went to a congress in Chicago of the same topic, and there I was trained and got in contact with the Latin American committee that was involved and a community that was involved in it. And it has led me to get more and more involved in public policies. In 2001, I was an active participant of all the negotiations, and I was assigned to be the coordinator of these of our region, so that we could create a network representing over 100 countries. And this is another way that we have to consider, creating global networks of stakeholders, those who are really interested in addressing the topic of the pandemic we are experiencing, but also of a future pandemic to come. How can we get prepared to them? The participation has really taught me so much. I was trained from key leaders in the area. 20 years later, it's so much easier, isn't it? Thanks to the connections we all have. But at that time, I just got closer to people from all different countries involving international agencies and the academia. And this is essential to create networks. And of course, by doing that, we can create mutual respect and mutual solidarity. As years went by, I have got involved with the North American Association of Cancer, Lung, and a number of other organizations, the Alliance and WHO, were trying to find someone who could dedicate some time to work in the region and to help leverage this treat and to obtain its confirmation. I was appointed for the position and left part of my clinical practice to travel to different countries, get together with people, with politicians, with legislators, work with the press, and I was a regional coordinator of the topic also for other regions, because other people from the specific regions join us in this effort. And this is also something important. We should always have people who are willing to coordinate local efforts. As we didn't have many resources at that time at the regional level to move ahead, I've focused on 3 strategies to really carry on with different projects and encourage the organization and the civil society to bring them to discuss the topic. And at the same time, we wanted to promote national networks of tobacco control to really move ahead. And we also selected one model country where we could have a pilot test of this policy and start seeing a domino effect in the region. As I was the coordinator and as I was living in Uruguay, Uruguay was selected at that time. At the same time, the regional organization decided to obtain resources and places where it was 100% tobacco free. That was an attempt to build awareness and to really convince everyone of the importance of these campaigns. This is something important. We have to define what is the most important strategy. In that case, for COVID, it seems to be immunization, but we really have always to analyze what is the topic and how can we really control better the situations. But I believe that the main catalyst that we have had to deal with the situation was this treaty, this partnership that got into effect in 2005. And I really emphasize the importance of having a global pact such as this to get prepared to pandemics. And this should be in all different countries. And in our case, having this common pact and treaty served really to apply pressure. It was based on evidence, it had a multi-sector understanding, and it also included a democratic and solidary nature to it. And we participated the contribution of low and middle income countries, which could not have participated if it hadn't been for the additional funds. And by doing that, we could really evolve in our campaign. So I think a pact or a treaty like that should really include all the stakeholders, should really bring together updated evidence about COVID-19 so that we can get prepared and avoid future pandemics. And in addition to that, and something that can be compared to what we did in the smoking cessation, and we can use as a reference the pact and the agreement that we did for smoking.
When we began with this topic, we fostered this National Medical Association to create a national alliance to control tobacco. It was the first in the region, then it was replicated in Peru and in Chile. This alliance was key to ratify and prepare the path for the legislation in tobacco control. This type of alliance should be established at a national level based in science and also with legislators and lawmakers so that it can indeed become a national policy to face the problem. There was a workshop at the Pan American Health Organization. Uruguay became the first tobacco-free country in Latin America. 2003, it was a vision, and we need to have a vision of a world that is better prepared with better health to avoid future pandemics, as well as solving the current one. So I'm telling you the story. Yes, March 1st, 2005, we had as president Tabaré Vázquez. He's an oncologist, and he committed to applying the commitments that Uruguay had committed to. And Uruguay was successful in controlling tobacco. It became a leader with no political will, with no political commitment. It's difficult to reach results and change the situation, being better prepared. Tabaré Vázquez was a key factor, of course, for tobacco in Uruguay, but it was not the single factor, because at the time in the region, there were another physician who was a president, and in this country, nothing happened. There was no political difference. Why is that? Well, because besides having a committed president or politician, there was a previous work from the civil society, from the academy. There was a quick connection established between the Ministry of Health, the president, and there was a trust and mutual respect. Because of that, Uruguay became, in 2006, the first Latin American country, smoking-free country. This would not have seemed possible a couple of years ago. In 2016, 18 of the 20 Latin American parties of this commitment had approved the tobacco-free commitment. So we can have a model country, turn this model into a model and show other countries that it is possible to combat this epidemic and be prepared for other epidemics. How did we manage to do this change? Well, there was a treaty. Also, there was a major cooperation and solidarity between countries. Those that were more advanced were guiding and supported those that came behind. And when regional leaders were attacked by Philip Morris, a tobacco company, everybody defended that leader. So that's how I want to highlight North-South cooperation. Of course, this would not have been possible without the support of international organizations, such as Vital Strategies Campaign for Free Tobacco, and philanthropic universities such as the Bloomberg Foundation, who have invested in funds to develop advocacy initiatives. As a final remark, I wanted to say that the process of this commitment is a huge multinational collaboration which became a world public health movement. It is currently a benchmark to talk about non-transmittable diseases. And through international cooperation and transregional cooperation, and also local national cooperation between different disciplines, backed by these norms and this international framework, that's how we managed to obtain an important impact. That could perfectly be replicated, of course, considering specific differences when it comes to COVID-19 and preparing us for future pandemic situations. Thank you very much. Thank you very much, Mr. Bianco. Mr. Mandetta, Mr. José Luis Castro emphasized the data system, the importance of data systems. Eduardo Bianco talked about the importance of this global treaty and the importance of global networks of stakeholders. You headed the health minister in Brazil in a very tough moment, the beginning of the pandemic, when we didn't have a lot of knowledge yet about the disease. It was a moment when every single day we faced many huge challenges. And in front of the health ministry, and those of us who are working in hospitals, providing health services in the front line, every single day, we were facing extremely difficult situations. And I think you are the best person to talk about the lessons learned, the lessons you learned with your experience, and transferring these lessons to other areas. I would like even to know if you agree with my vision that we can now foresee this transition from a pandemic to an endemic situation. I am aware that the world situation is still quite complex, with a lot of disparities and gaps in the access to vaccines. This is a very serious problem from a moral standpoint. This is something that is hard to understand. But when we think about this, do you agree that we could maybe foresee a transition into a situation of an endemic context? When we think about Latin America, how could we work on better collaborative models to face our current situation and our future situations? You have the floor, Mr. Mandetta. Thank you. I'd like to thank the organizers at FIS for the invitation. I'd like to thank my dear friend Ari. I am speaking from the state of Mato Grosso do Sul in the west of Brazil, and we've met since college. Mr. José Luis Castro, thank you for your brilliant presentation. And Mr. Eduardo Bianco, tobacco is a very important topic in Brazil, and we have moved forward. These are battles that we face through different mechanisms. I'm going to try to have some logic in my presentation. In the beginning, what were the governance structures that we had to collaborate? And what spaces did that happen? The world has been organized since the post-war period through international organisms. The WHO, of course, should be the greatest mechanism for mankind or humankind to face a global health crisis. The WHO should be the major collaborator of supply networks, production networks. The WHO should be the forum where major world leaders should sit down around the table to build a logic and smart solution. So we saw the failure of this international mechanism because of a lack of leaders capable of understanding that this was not a physical problem restricted to boundaries, to country boundaries. The beginning of the pandemic is marked by fragile information coming out of China. Humankind believed that this would just be another difficult virus such as SARS or MERS, which we faced in that region some years ago. However, this virus quickly showed or presented itself as a highly transmittable virus, and it was destroying different health systems, first in Iran. At first, we thought that Iran might face some specific difficulties, but then it was Italy, Germany, England, and the UK and the US. Well, Latin America and South America, I would say specifically, thinking about our geopolitics being more connected to South America, because Mexico has more of a connection with the US and Canada. Canada has a more organized health system from a preventive measure perspective and also health services. The US has a system that is very fragmented into different states. The US removed the CDC, which could have been a leader in the Americas, a scientific leader. So they removed from Bob Hutterfield the lead to the pandemic, and it was transferred to Mike Pence. President Trump grabs a box of chloroquine and says, this will solve it. And that contaminated other leaders. In South America, we began looking at our own region. While I was a health minister, right in the beginning, I went to Asunción in Paraguay to have a meeting with ministers from Uruguay, Argentina, Paraguay, in the Mercosur area. And then with the Pan American Health Organization, we created an arm to organize ourselves with countries from the Andean region so that we could articulate, exchange experience, and exchange defense mechanisms for our region. The first concrete act was when I designated Fiocruz in Brazil to do the tech training of all countries to do PCR-RT tests. This was all conducted by Fiocruz to all Latin American and Central American countries. Then with the Pan American Health Organization, we went into the war for individual EPPs. And what seemed not to work in South America? The world decided to adhere to the Chinese economy of scale of producing masks and supplies, and China decided to shut down its exports. They concentrate 90% of the production of ventilators, all monitors, and out of nowhere, we see presidents from different countries trying to acquire the highest possible volume of supplies. I remember British nurses wearing plastic trash bags in their heads in an attempt to protect themselves. Whereas we in South America were extremely vulnerable because of a problem with basic health supplies such as masks, cotton swabs, syringes. We acquired all of that from China. But that also had an impact in developed countries. And I think that one of the first convergence points for Latin America will be building an industrial complex in the health sector so that we have a South-South axis, because African countries were out of supplies as well. And with that, if we think about regional sovereignty, we could decrease our full dependence and reliance in terms of health supplies. In that same meeting, we attempted to create a joint movement, but some political leaders who were involved in elections, whether they were presidential or regional elections, they decided to make unilateral decisions. There was a sequence of physical boundaries and frontiers that were shut down in the Americas, and that happened mostly because of political pressure. We didn't have one leadership capable of organizing dialogue within the Americas. So this toxic political leadership shows when there's no articulation, this is actually associated to the virus. It becomes part of the disease, and this was responsible for many sad episodes throughout the pandemic. We saw the collapse in Ecuador. We saw a dramatic situation in Bolivia. We saw the inequalities inside Brazil and regional inequalities in terms of models of health services and a lack of access to vaccines. We cannot think about normalizing the situation because we have countries that have not reached 10% of vaccine coverage in the Americas because they have no access to vaccines. This is a reflect of the deindustrialization. Brazil still has two structures producing vaccines, Butantan and Fiocruz, these two institutes. But this is not enough for the size and for our scale as a region. The world was lacking so many leaders that we saw major powers purchasing 6, 7, 10 times their need of vaccines, and then they were doing diplomacy with vaccines, which is it's a very cynic position. And we saw a sterile discussion about breaking down with the patent legislation. And this should be included in what we call a new international health regulation, which should be rewritten. We do know that we will have new pandemics. We are aware of that. We don't know when, whether this will be tomorrow, whether it will happen in 10 years and 50 years, but it is a fact. We will face new pandemics. Brazil is a high-risk country for the emergence of new diseases, as well as the Amazon region countries. The more deep we are into the forest, the more deforestation there is, and the more we change the ecosystem, the more viruses will be transmitted to human beings. And the virus monitoring in the Amazon region is very low. We have a study in tropical medicine in Manaus. We have Evandro Chagas, and then we have a void in terms of these studies. And that makes us a very vulnerable country to new viruses. And this has a direct connection with a climate issue, climate and health. This is a reference point to climate issue. Health is a convergence point. And this is another topic in which we could collaborate in the Americas to monitor and to do health vigilance and surveillance. We can be coordinated by the existing mechanism, which is PAHO, the Pan American Health Organization. It's the only structure that has a dialogue with Venezuela. Venezuela is a problematic country. They do not investigate many cases of the disease, and we are afraid that diphtheria will come back. If there is a problem in the Americas, Brazil will begin to produce this, knowing that it's just a matter of time so that this disease comes back again. And measles can also be a problem because of low vaccine coverage. We might see major agreements in South America so that we can finally behave as a regional health bloc, and then having local regional solutions. We should not be a problem, and we should cease to be an importer. Brazil spends over $40 billion. The soybean harvest is burned just to pay for our dependence when it comes to health services. The Brazilian market is huge, and it's also a point of convergence and collaboration. A unified purchasing process from South American countries could be positive. Some medications are very expensive. Brazil has the ability to negotiate with the industry at prices that are 70% lower than Uruguay's. Paraguay sometimes cannot buy these medications, and some people don't want the unified purchase. And this is an important topic. Spinraza, it's a medication for spine atrophy. we shared this risk, and the price we paid, we offered this to other countries to purchase. There was a chamber of compensation so we could have easier access to this type of medication in the Americas. If we don't solve this situation, things can become more severe. From a pandemic perspective or an endemic perspective, as you very well said, we will probably, yes, transition into an endemic situation. I think we will have good news, not just in terms of the improvement of the efficacy of vaccines. I believe that Moderna is saying that the COVID vaccine will now be provided together with the flu shot. So this technology must come to our countries as well. It's going to be much easier to control these diseases, and prices will become cheaper for these vaccines. But the pent-up demand in the Americas is absurd. Our country has made less than 40% of breast cancer exams than we should have made in the last 2 years. So we're going to face a tsunami. It's as if this wave went backwards and now it will come forward. It's going to be a tsunami of breast cancer. And I'm saying breast cancer, but we could say prostate cancer, cardiovascular problems. Health will face a huge impact in the Americas because we did not have prevention measures in the last 2 years. This should also be a collaboration point, and it should be. In the 21st century, what really marks the scientific evolution is gene therapy, genetics. After we decoded the DNA, then we have the Genome Project, all the discoveries of genes that are behind many diseases. After that, we see possibilities of cure for many diseases, Duchenne's, Alzheimer's, type 1 diabetes. However, CRISPR, there is a technique, and we don't hold this technology. We don't hold the rights, and we should be. Otherwise, we will be easy prey in the 21st century. And the 21st century will be the center of genetics.
Brazil, it started its program of Brazilian genomics, and it should be done in collaboration with Latin American countries. We cannot afford to have an isolated solution. Brazil should not have one solution that is not available to Paraguay. We need everyone healthy. Paraguay, Bolivia, we need a balance of the ecosystem and a balance of ecosystem in the Americas. We have to get together and discuss the international sanitary regulation, the existing one. The health regulation code is not enough. The world is getting prepared, and within the international health regulation code, we are going to have not only goods, people, but also animals, which is something important for countries such as the Americas, because we really export animals. So our diplomacy really has to work together, and it should be working aligned with all the countries. In this endemic, the virus has left a trace of mental health. Mental health is the main insult to impact healthcare systems. So suicidal attempts, depression, caused by organic and social causes of unemployment, loss of companies, loss of work formats, work which used to be just done on site and now are done remotely, just using unqualified labor. And we are going to pay a social price throughout the whole 21st century unless we invest in education in an articulated, joint fashion. Telemedicine is a wonderful tool, and it can bring together specialists and family physicians who operate here in the Brazilian market. They are fully disseminated, but not throughout the other countries. And by doing that, we can improve universal access to health, which is one of the items of the Agenda of 2030 for the UN. As you can see, we still have got a lot to cover. the Convention of Tobacco has to be signed by Paraguay. This is where the cigarette industry, tobacco industry, produces in large scale, low tax, and then transfer that to other countries at BRL. So really compromising the efforts of the countries which are fighting against the cancer of tongue and bladder and others. So leaders in economy, they have to understand it's a good thing to increase taxes on tobacco. Leaders have to understand that it's a good policy where they reduce eating salt, saturated fat, so that we can also cut on obesity, especially pediatric obesity. Mexico has a good experience. The US, they are paying such a high price because they neglected a food safety policy. We have taken an important step. Brazilian food guide. It can be provided to Portuguese-speaking countries and also Spanish-speaking countries. I think that would be a way of really calling the attention of industry for what they can do to help us. I think they are all opportunities of working closer in the Americas. The current model concentrated on Chinese production is not worthwhile. The world has been looking for alternatives. In Europe, they are thinking about using the Second World War bunkers to make inventory warehouses. In the US, they are looking for alternatives to reach sovereignty. Brazil has 200 million inhabitants. South America, Mexico, US, Canada, we get to 1 billion, and we could definitely have a high-scale cooperation initiative and, of course, share the cooperation among ourselves, especially on the South-South axis. I think countries have a lot of opportunities, and we need leadership to really have the next generation leading the interests of the future. If we can make them see what to do and really have a people-centered policy to address diseases that really cost a lot, making people pay for things which are not for us to pay the bill. Latin America is a victim of the tobacco industry, of the food industry, everything that is really forced to us. And because of our local incompetence, we failed to analyze neglected disease, and we call them neglected, but we neglected them. The technology of mRNA of Moderna and Pfizer may be a solution to malaria, dengue fever, leishmaniasis, and this is a huge opportunity for us to address. So we have so many opportunities. We also have possibilities of joint work with Palasul, Mercosur, Andean countries. However, nobody's willing to really work. If we work and work hard, Latin America and South America can give a very good response to what is expected for the new humankind, the globalization that exports technology assets and end up importing just basic and consumer goods is not something that speaks to our Latin America entrepreneurial people, industries, and we have really been very much impacted by this concentration of all production in China. We don't have to retaliate. What we have to do is create alternatives in South America. I think we have good opportunities, but we have to pay attention. Otherwise, we are just going to spend the whole 21st century being held hostage by these countries and having, especially all of us who have put up with so many deaths here in Latin America. We can no longer play this game of the absurd. We really have to bring together private initiative and especially the government to come up with intelligent, smart solutions. And there are just so many alternatives. We just have to look to the problem straight to the face. Thank you very much. Thank you, Minister Mandetta. Thank you, all of you. We are coming to the conclusion. We had 1 hour and we've already just got to the end of our time. But I would like to thank your message of hope, former Minister Mandetta, and your message, which has brought very important elements, let's say, points of convergence for a common collaborative agenda in Latin America, involving the healthcare industrial complex, really innovation, through the genetics, joint procurement, collaboration among our countries, involving telemedicine as well. I think it was wonderful to hear you, and I really appreciate that. I would also like to thank José Luis and Eduardo for their contributions, for everything, for their inputs towards more collaboration. And let me thank once again our initiative, FIS, which has given us the opportunity to discuss this topic. I would like to thank you all very much for your openness and generosity and for having shared with us your knowledge. Thank you very much.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Just trying to find my way. Every day, just trying to find my way. Every day. É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história. I'm gonna break through.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown. Fueled by imagination, alone and with others. Repeating an experiment 1,000 times to have the chance to get it right. Once, but for forever. making brave choices, choosing to push the boundaries, and choosing again and again to be led by science in everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease, the best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós, da Pena Saúde, temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos. Proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos. Realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano. E movimentamos mais de 3% do PIB. Nosso desafio é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues, enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow. Microsoft Cloud for Healthcare, empowering health organizations to deliver better experiences, better insights, and better care. Learn more at aka.ms/cloud-for-healthcare.
A Pronep Life Care, uma marca do grupo Sodexo, é uma das empresas pioneiras na atenção domiciliar no Brasil. Desde sua fundação, a Pronep Life Care já cuidou de mais de 35 mil vidas e atende em todo o país mais de 2.000 pacientes por dia, atuando no cuidado e atenção às mais variadas necessidades. Tudo feito por uma equipe altamente qualificada e especializada na casa do paciente, de acordo com suas necessidades individuais e com acolhimento e cuidado. A qualidade do nosso atendimento garantiu o reconhecimento da Joint Commission International, JCI, que nos certificou com um selo respeitado mundialmente. Tudo isso para levar ao paciente e sua família qualidade de vida e conforto, sem abrir mão de cuidados médicos de excelência.
A Pronep não deixa faltar nada para minha filha. Eu sou muito bem tratada por eles. A equipe é muito boa, é tudo muito bem engrenadinho. É mais vida para o paciente, mais vida para você.
Pronep, movidos pela vontade de fazer o bem.
Nestes mais de 120 anos de história, entendemos o poder de um diagnóstico preciso e rápido na qualidade dos cuidados com a saúde. Quanto mais conhecimento, melhores são as decisões. E maiores as chances de superar desafios para vidas mais longas e com mais saúde. Por isso que na Roche Diagnóstica, investimos tanto em pesquisa para o desenvolvimento de soluções e equipamentos. Em pessoas que podem inovar e melhorar processos e serviços. E no compartilhamento deste conhecimento que produzimos para o benefício dos pacientes. Isso é valioso. Como líderes, devemos ter consciência e orgulho do nosso poder de impacto na gestão da saúde no Brasil. De desenvolver o mercado, antecipando necessidades e soluções. Queremos ampliar ainda mais nossas condições de produzir informações relevantes e seguras, viabilizando melhores decisões clínicas, para que as pessoas vivam mais e de maneira mais saudável. É isso que nos move. Possibilitar cada vez mais acesso à melhor medicina de precisão para o maior número de brasileiros.
Seja qual for o seu caminho profissional, o Senac tem um curso para você aprender fazendo. Você pode começar uma profissão do zero ou seguir nossa trilha de desenvolvimento e se aprimorar cada vez mais na sua carreira. Aprender fazendo é a metodologia exclusiva do Senac, que tem foco na prática e faz toda a diferença na formação dos nossos alunos. Saiba mais sobre ela aqui no site. Depois, continue navegando para escolher seu curso e garantir sua matrícula. Senac, todas as formas de aprender fazendo.
Developed Protector, Environmental Infection Control. Based on international best practices, so we can assure a clean and safe hospital environment, the Protector Advantage is about people, process, and technology. Through education and management, it achieves expertly trained and motivated frontline cleaning staff committed to their vital role in eradicating hospital-acquired infections. Standard processes detail who is responsible for cleaning which items and areas and what products and techniques to use. Protector incorporates the latest, most effective, clinically proven cleaning and decontamination innovations from across the planet. And from assessment to auditing to analysis, it works with you to drive additional value from under-pressure financial resources, ensuring patients are kept free from harm so they can go home when they should. Protector, environmental infection control from Sodexo. Your advantage in the fight against hospital-acquired infections.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Comets. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso Mercado Central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso Oasis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Trying to find my way. Every day, just trying to find my way. Every day. É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história. I'm gonna break through.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown, fueled by imagination, alone and with others, repeating an experiment 1,000 times to have the chance to get it right, once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science. In everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease. The best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós, da Fena Saúde, temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos. Proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos. Realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano. E movimentamos mais de 3% do PIB. Nosso desafio é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues. enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow. Microsoft Cloud for Healthcare, empowering health organizations to deliver better experiences, better insights, and better care. Learn more at aka.ms/cloud-for-healthcare.
A Pronep Lifecare, uma marca do grupo Sodexo, é uma das empresas pioneiras na atenção domiciliar no Brasil. Desde sua fundação, a Pronep Lifecare já cuidou de mais de 35 mil vidas e atende em todo o país mais de 2.000 pacientes por dia, atuando no cuidado e atenção às mais variadas necessidades. Tudo feito por uma equipe altamente qualificada e especializada na casa do paciente, de acordo com suas necessidades individuais e com acolhimento e cuidado. A qualidade do nosso atendimento garantiu o reconhecimento da Joint Commission International, JCI, que nos certificou com um selo respeitado mundialmente. Tudo isso para levar ao paciente e sua família qualidade de vida e conforto, sem abrir mão de cuidados médicos de excelência.
A Pronep não deixa faltar nada para minha filha. Eu sou muito bem tratada por eles. A equipe é muito boa, é tudo muito bem engrenadinho. É mais vida para o paciente, mais vida para você.
Pronep, movidos pela vontade de fazer o bem.
Nestes mais de 120 anos de história, entendemos o poder de um diagnóstico preciso e rápido na qualidade dos cuidados com a saúde. Quanto mais conhecimento, melhores são as decisões. E maiores as chances de superar desafios para vidas mais longas e com mais saúde. Por isso que na Roche Diagnóstica, investimos tanto em pesquisa para o desenvolvimento de soluções e equipamentos. Em pessoas que podem inovar e melhorar processos e serviços. E no compartilhamento deste conhecimento que produzimos para o benefício dos pacientes. Isso é valioso. Como líderes, devemos ter consciência e orgulho do nosso poder de impacto na gestão da saúde no Brasil. De desenvolver o mercado, antecipando necessidades e soluções. Queremos ampliar ainda mais nossas condições de produzir informações relevantes e seguras, viabilizando melhores decisões clínicas, para que as pessoas vivam mais e de maneira mais saudável. É isso que nos move. Possibilitar cada vez mais acesso à melhor medicina de precisão para o maior número de brasileiros.
Seja qual for o seu caminho profissional, o Senac tem um curso para você aprender fazendo. Você pode começar uma profissão do zero ou seguir nossa trilha de desenvolvimento e se aprimorar cada vez mais na sua carreira. Aprender fazendo é a metodologia exclusiva do Senac, que tem foco na prática e faz toda a diferença na formação dos nossos alunos. Saiba mais sobre ela aqui no site. Depois, continue navegando para escolher seu curso e garantir sua matrícula. Senac. Todas as formas de aprender fazendo.
Developed Protector, Environmental Infection Control. Based on international best practices, so we can assure a clean and safe hospital environment, the Protector Advantage is about people, process, and technology. Through education and management, it achieves expertly trained and motivated frontline cleaning staff committed to their vital role in eradicating hospital-acquired infections. Standard processes detail who is responsible for cleaning which items and areas and what products and techniques to use. Protector incorporates the latest, most effective, clinically proven cleaning and decontamination innovations from across the planet. And from assessment to auditing to analysis, it works with you to drive additional value from under-pressure financial resources, ensuring patients are kept free from harm so they can go home when they should. Protector, Environmental Infection Control from Sodexo. Your advantage in the fight against hospital-acquired infections.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Comets. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso Mercado Central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso Oasis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Trying to find my way. Every day, just trying to find my way. Every day.
É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história.
I'm gonna break through.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown, fueled by imagination, alone and with others, repeating an experiment 1,000 times to have the chance to get it right, once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science in everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease, the best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós, da Fena Saúde, temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos. Proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos. Realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano. E movimentamos mais de 3% do PIB. Nosso desafio é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues, enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow. Microsoft Cloud for Healthcare, empowering health organizations to deliver better experiences, better insights, and better care. Learn more at aka.ms/cloud-for-healthcare.
A Pronep Lifecare, uma marca do grupo Sodexo, é uma das empresas pioneiras na atenção domiciliar no Brasil. Desde sua fundação, a Pronep Lifecare já cuidou de mais de 35 mil vidas e atende em todo o país mais de 2.000 pacientes por dia, atuando no cuidado e atenção às mais variadas necessidades. Tudo feito por uma equipe altamente qualificada e especializada na casa do paciente, de acordo com suas necessidades individuais e com acolhimento e cuidado. A qualidade do nosso atendimento garantiu o reconhecimento da Joint Commission International, JCI, que nos certificou com um selo respeitado mundialmente. Tudo isso para levar ao paciente e sua família qualidade de vida e conforto, sem abrir mão de cuidados médicos de excelência.
A Pronep não deixa faltar nada para minha filha. Eu sou muito bem tratada por eles. A equipe é muito boa, é tudo muito bem engrenadinho. É mais vida para o paciente, mais vida para você.
Pronep, movidos pela vontade de fazer o bem.
Nestes mais de 120 anos de história, entendemos o poder de um diagnóstico preciso e rápido na qualidade dos cuidados com a saúde. Quanto mais conhecimento, melhores são as decisões. E maiores as chances de superar desafios para vidas mais longas e com mais saúde. Por isso que na Roche Diagnóstica, investimos tanto em pesquisa para o desenvolvimento de soluções e equipamentos. Em pessoas que podem inovar e melhorar processos e serviços. E no compartilhamento deste conhecimento que produzimos para o benefício dos pacientes. Isso é valioso. Como líderes, devemos ter consciência e orgulho do nosso poder de impacto na gestão da saúde no Brasil. De desenvolver o mercado, antecipando necessidades e soluções. Queremos ampliar ainda mais nossas condições de produzir informações relevantes e seguras, viabilizando melhores decisões clínicas, para que as pessoas vivam mais e de maneira mais saudável. É isso que nos move. Possibilitar cada vez mais acesso à melhor medicina de precisão para o maior número de brasileiros.
Seja qual for o seu caminho profissional, o Senac tem um curso para você aprender fazendo. Você pode começar uma profissão do zero ou seguir nossa trilha de desenvolvimento e se aprimorar cada vez mais na sua carreira. Aprender fazendo é a metodologia exclusiva do Senac, que tem foco na prática e faz toda a diferença na formação dos nossos alunos. Saiba mais sobre ela aqui no site. Depois, continue navegando para escolher seu curso e garantir sua matrícula. Senac. Todas as formas de aprender fazendo.
Developed Protector, Environmental Infection Control. Based on international best practices, so we can assure a clean and safe hospital environment, the Protector Advantage is about people, process, and technology. Through education and management, it achieves expertly trained and motivated frontline cleaning staff committed to their vital role in eradicating hospital-acquired infections. Standard processes detail who is responsible for cleaning which items and areas and what products and techniques to use. Protector incorporates the latest, most effective, clinically proven cleaning and decontamination innovations from across the planet. And from assessment to auditing to analysis, it works with you to drive additional value from under-pressure financial resources, ensuring patients are kept free from harm so they can go home when they should. Protector, Environmental Infection Control from Sodexo. Your advantage in the fight against hospital-acquired infections.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Commits. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso Mercado Central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso oásis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Just trying to find my way. Every day, just trying to find my way. Every day.
É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história.
I'm gonna break through.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown, fueled by imagination, alone and with others, repeating an experiment 1,000 times to have the chance to get it right, once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science in everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease, the best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós, da Fena Saúde, temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos, proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos, realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano e movimentamos mais de 3% do PIB. Nosso desafio é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues. enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow.
Excellent day, so many leaders, so great content. And now we have a panel for the new economic and sanitary order. Who do we have in our panel? Adalberto Fernandes, former Minister of Health in Portugal, professor of the School of Public Health, Jarba Barbosa, with OPAS, Marcelo Fioranelli, CEO of Airgas, a company of air liquids, and our moderator is José Luis Alqueires. He's Executive Director of JL Alqueires Consultores Associados. We hope you have enjoyed this wonderful week. Share your experience. Please tag us and use our filters. We love to follow you. Well, thank you very much. And tomorrow we'll be here with you. But before that, we have a great panel and we are connected in all the social media. Don't forget to check trust and really enjoy our content. Hope you have enjoyed this day. See you tomorrow with so much more information. Good afternoon. Shall we start? Yes, I guess we can start. Can you all hear me? Yes, yes, we can hear you. Well, I guess we can start, right? Okay. So let me start by greeting all of you. It was so great to hear about your positions. My father was Ministry of Health. He was also chairman of PAHO and also VP of the WHO. So to some extent, I feel at home, even though I'm an engineer by training and also a business person. It is wonderful to have these distinguished speakers here with us. We are going to talk about the new economic order, the new world economic order. And to start, to kick off our session, I would like to tell you that we are ready to go into the new order. We are on the verge of a new global order. It has always started, in fact, and it started some decades ago. In 1970, UN held the first World Conference on the environment. Years later, in our Common Future report, coordinated by Goldbrüter, a minister in Sweden. And only 12 years later, the New York Stock Exchange market, through Morgan Stanley Sustainability Index, effectively started to codify companies and to what extent they really complied with the environmental rules. In the following year, the climate change panel was created. While corporate really resisted. They didn't want to acknowledge that the world had gone into a new stage, which is now called the Anthropocene.
Which means that the conditions of life in our planet depend much more on the predominance of our species, Homo sapiens sapiens, and the way it's organized is now on changes in the natural order of things. And those changes, they actually have on their basis the change of the economic organization, a very or profoundly perverse organization that creates billions, we may say, of hunger and miserable people and a large income concentration. In some countries and within countries, and some people, families, and companies. This is reflected into a production system that is highly predatory of natural resources and that drives great pollution that impacts greatly livelihoods, health conditions, and today we see the very conditions of survival in the life of the planet because of the increase in temperature, high seas, lung diseases, and several consequences that the man seemed to ignore in his permanent search for a consumerism standard of life. WHO, Pan American Health Organization, PAHO, and I would say the health agencies in the whole world have been a voice pointing out to how noxious this is to our future. But only when those conditions were added to economic conditions and economic conditions deriving from the association of the combination of what we eat and what we use in terms of power with these negative effects. And only now the world is trying to wake up, and UN has established the goals of the millennium and now the Sustainable Development Goals. Well, this requires initiatives in 17 fields. It's a lot in many work fronts, but there is no doubt that the pandemic outbreak somehow came to reinforce this vision that, after all, our planet seems to be saturated by so much despite, so much ignorance, so much denial regarding what man produces. And since we have the pandemic, and there may be others, and everybody got moved, and the world can actually have the penny to drop, and people seem to be willing to work towards a way of world governance. The two other ways, the League of Nations after the First World War and the UN after the Second World War, they were stemmed from wars. And now the governance debate does not come from a war. It comes from an effect that is being as damaging, as so disproportionately inhuman as have the last century's wars been. In this setting, by understanding that the world has become our common house, as Pope Francis said at the encyclic in 2015, Laudato Si, that we have responsibility regarding this common cause. As a recent study of the London University has pointed, what would be the investment of greatest return to the world? It would be to send teams and vaccinate for free the whole of Africa, because this would hold the extension or dissemination of the pandemic. This would cost 45 billion pounds, but this would be an investment of high return, because the company once again would have their aircrafts full, their cruise ships packed, and the world is now gathering in Glasgow, trying to digest it all. And the difficulty of having a global governance is acute, so much so that US and China are announcing their own pact within global governance, sort of bypassing these large and past that created in the past this common dwelling. I am in the presence of great experts, and I'm just a businessman concerned about the future. So I'm going to move on with our meeting, and we're going to have the pleasure of listening, first of all, Professor Adalberto, who honors us with his presence. Thank you very much. Thank you. Good afternoon from Lisbon. Well, actually, it is the evening now. It is a pleasure to be with our friends from Brazil, and I'd like to actually congratulate our speaker for his excellent speech, and it helps a lot the reflection that we have. The topic was assigned, and paraphrasing Pope Francis in the encyclic of 2015, over politics, we have a will to understand worldwide the meaning of human life. And one of the positive aspects which globalization has brought to us is perhaps a greater possibility of our understanding the world in its multiple dimensions. We know that the critical factor of instability in the world and delay in its development, consistent lack of care, is a factor related to the persistence of inequalities, and inequalities between North and South, between rich countries and poor countries, and developing countries and poor countries. Whilst we do not stabilize on the planet an objective of development that is sustainable, and at the same time allows the development, human development, to be aligned with this economic development and industrial one, we will continue having the problems we had. COVID-19, as it's been quite well put, is only an episode in what is the normal process of epidemiological nature that mankind has known for many centuries. if we review the history of pandemics, we'll see that regularly and probably from now onwards in shorter periods of time, we will confront ourselves with situations like this. Of course, the natural phenomenon, biological and expected phenomenon of nature, infectious nature, but in the world is not free of phenomena like this, non-natural nature. And this is a question that is present in the dimension of security of the countries and strategic defense. The countries have to consider their protection of their populations. And COVID-19 had its peculiarity. The SARS-2, it came from the Asian continent, from China, from east to west, from north to south, and did not have any filter regarding the specific conditions of each country. In other words, from the standpoint of epidemiology, it was democratic because it has reached equally the most developed and richer countries with evolved health systems, and later, after some time, it impacted the less developed countries. What happens is that it was possible for humanity to understand that the simple fragment of RNA was able to put civil aviation on the ground, managed to block the economy, and managed to make millions of people to have a normal life at work and had to be limited in their personal, professional lives at home. The lessons we have to learn from this process, on one hand, that globalization should not serve, as it's been referred quite well, that the world makes sort of misuse of natural resources. So we should have this vision of deepening and of try to avoid actually inequalities between countries and people, and the world will gain a lot from the standpoint of international cooperation. This is the role of international organizations from the UN, from WHO and the PAHO, and we have our colleague certainly has this experience, and it is very important in what has to be fulfilled in their skills and capabilities. We have to embed in the political discourse sharing, coordination, and understanding. Scientific investigation, development, technological development have to be something that the world gets used to share in a way that is co-creative and in a cooperative way. What has been happening with vaccines has been unveiling that still today what prevails a level of egocentrism, distribution of the benefits that scientific investigation brings. It's been mentioned what happens to Africa, the estimated cost of 35 million pounds to distribute vaccines throughout the African continent certainly would have a return that would multiply by 10 or even 12. Well, countries like that allow me to mention the case of Brazil, that is a large continental-sized country, but it has a major role in the world. Countries like Russia, like naturally China and the US, the European unions, they have to be countries that promote understanding, sustainable development in the world, considering SDGs, but also in view of what we have today. We have 7.8 billion inhabitants in the world, and we're reaching the maximum level of sustainability if nothing is done. I would like to share and remind you, currently I don't have this information, that we have in Portugal, we have a very serious problem of demographics. We are one of the two countries that is more so beyond this threat.
Envelhecido, oldest. oldest, envelhecido.
So we have that related to COVID and other types of processes. We are a country with a lot of elderly people. And this is one of the oldest countries, or people with most elderly people in the continent. So this has been a debate. Was the new order a new economic order and a new sanitary order? They are connected, interconnected, but for the first time we noticed that this thing is related to economy, and a public health crisis has actually blocked the functioning of world economy. And this view that is very much experienced in Europe. I've been to Brussels a few days ago, considering this new professional authority, the European authority, talking about emergencies in public health. It is clear today in the very European Union, and I believe the US, and probably Brazil, understand that investment in health cannot anymore be seen as a cost. It's investing in people and actually fostering better economy. We were caught by surprise. We had many people that suffered, many deaths, casualties, patients that faced hardships, but we had reduction of wealth that till today is lasting, whose effects we were unable to anticipate. That what new economic order, new sanitary or health order we're going to have, it's hard to tell. I believe that the empowering and the role of the UN will be key, and the empowerment of organizations like the World Health Organization is key, and this can work as an increase of encouragement to understanding, and actually the understanding and sharing of richer nations towards poorer nations. And the pandemic, we may have to face a new pandemic, and this should be something that should be recovered and be more trained, not only in terms of health response and public health and care, but in the great drive towards scientific investigation and development. And I would stop here. Naturally, greatly honored and very happy to participate, discuss with our panelists. And thank you very much. I will hand over to the next speaker. I suggest it should be the director of the World Health Organization.
Thank you very much. First of all, I would like to thank the invitation from FIS initiative to take part in this week of debates and reflections. And so, considering everything that was presented here by our colleagues from Portugal and other panelists, I'd like to share a little bit with you about the point of view of public health and new order and new governance. And now from the standpoint of health, first of all, there is a perception that no one was appropriately prepared for the pandemic. This is no criticism, of course. We are likely to plan the future based on our past experiences. And the past experiences that we had was the influenza epidemic in 2009 that was disseminated very fast, but didn't produce too many severe cases. Or its cousin SARS-CoV, MERS and SARS, that caused many severe damages, but disseminated more slowly, which facilitated control. No one was prepared, neither countries nor the global agencies that we have, such as the International Health Regulation, to respond to the pandemic with the severity that we had. The countries that has responded the best were the countries that were capable of adapting, of incorporating innovation quickly, in reviewing their plans to incorporate what the scientific evidence had been demonstrating, as effective measures and in this manner be able to advance. There's still a lot to do. The epidemic is not over yet. Now we have a worsening in some European countries such as Germany and Holland, and the growth in countries like Russia and in other countries might be a demonstration that the pandemic will continue. On the other hand, I think it's very important for us to discuss global governance, and we need to do that. So as the multilateral forums, we need to discuss the mandates for verification and response to outbreaks. And I think this is all going to be on a panel on an extraordinary World Health Assembly that we are going to have very shortly for countries to review global governance and to strengthen it. There are some countries defending that we should change the current instruments. Other countries say we should have a new treaty, but the spirit of acknowledging that what we have is not enough to respond to a pandemic that is as severe as this, then it may happen again in the future. You don't know when, but we know that there will be new pandemics. The world needs undoubtedly to be better prepared. A second reflection is the deep interrelationship between health and economy. And so there was a severe impact of the pandemic on the economy and in society as a whole. And then we may have in Latin America a reduction of more than 10 years in advances that had been obtained in the fight against extreme poverty and poverty. We also had an impact showing the intrinsic relationship between economy and health. And so even the low effectiveness of response in Latin America, before vaccines, when we only had public health measures, they were not enough. When we look at the European countries, when they have a significant social protection network, when they adopted or implemented drastic measures of social isolations, and 2 weeks later, of the measures, the transmission rates dropped immediately. We didn't see that in Latin America. We had a very long plateau for many months in Latin American countries, and many of the countries operated. And I think they're all in countries with higher mortality rates. But in countries where half of the economy is informal, a significant part of the population lives in very busy and crowded homes and in favelas. So it's difficult to assure that the poorer and more families would survive to the contention measures, and they were not really effective. A third point that the pandemic made very clear is that we need to build within this new global governance of health more resilient healthcare systems. The pandemic demonstrated the low resilience of healthcare systems, especially in Latin America, but even health systems in developed countries suffered and were not capable of responding to other public health problems in the most critical times of the pandemic. We are still analyzing everything, but excess mortality that we see in all countries in the Americas is very significant. And now we lost contact. And so this is about 20 to 25% of excess deaths. But there's still excess deaths due to other causes. People with cancer that found it more difficult to have access to treatment, hypertensive patients whose disease got out of control during the epidemic because of the lack of access to treatment and medications, surgeries that were delayed and that should have been done. So when we look at the map of health services in Latin America that we had designed for continuity or suspension of operation, we see that they had severe problems of interruption. just as we see the degree of exposure of healthcare workers, the mortality rates among healthcare workers in Latin America were much higher than it was in developed countries, because the healthcare system and professionals didn't have appropriate access to PPE, to well-established protocols for personal protection. And it demonstrates that we should have more resilient systems. There's an upside, though. All these very drastic crises has forced us to advance very much on some themes that were kind of left aside. Teleconsultation, remote counseling, the use of cell phones and platforms that were already accessible before but were not being used. If they are kept, they may be one important element to contribute for to knock down the barriers in access that are still present. Also, another important point is how the systems were not capable to operate to reverse the inequality, which is already huge in Latin America. So all countries with consistent data show excess mortality or higher risk of having severe forms of disease amongst Afro-descendants, poorer population, indigenous populations, and other more vulnerable groups. So they have more difficulty of access to services for all causes, and they also had it during the pandemic. So healthcare systems on the whole were not capable of defining strategies that were capable of reducing those barriers. Another important issue that we need to think about is undoubtedly the vulnerability of the concentration in the world of manufacturers of medications, vaccines, and health-related supplies. There was a disruption of logistic chains. In the Indian government, for example, suspended exports of vaccines and syringes, causing problems all over the world. Latin American countries had to fight to have access to masks and gloves in the beginning, and then respirators, PCR tests, and then vaccine. So all of this demonstrates that we need to think differently in terms of how to organize health governance and try to respond to vulnerabilities, strengthening the capacity for the production in Latin America in order to reduce this extreme dependence. And lastly, I think that equitable access mechanisms is important. I think that this image of sending people and vaccines to send people in Africa summarizes the correct idea that no one will be protected while everyone is not protected. So now we saw part of the explanation, the new waves in countries that had almost 75% of the population vaccinated. And part of it is due to the Delta variant has become predominant and producing significant outbreaks amongst non-vaccinated people. The equitative or the equitable access to vaccines is moral and ethical, but it's also related to public health. While there is uncontrolled transmission of the SARS-CoV-2 virus, there will always be the possibility that a new variant may emerge that will not be protected by the current vaccines. So we need to make right decisions such as the COVAX mechanism, but without clear rules to assure equitable access to production, this mechanism. I make the image, it was an excellent car with a very good engine called equity, but without fuel, because manufacturers have always given priority to give vaccines to our bilateral agreements, and some of them charging 30, 40, 50% more than they had defined for the COVAX. So defining rules for equitable access is also essential for the new health order that we must and should build. And we are going to have the World Health Assembly. It will be another step for us to advance in that direction. Thank you very much. Thank you very much. I think that the three of us are somehow agreeing and converging towards a major conclusion. because it's not due to sector-specific changes that the world will solve problems. The health change, the new health governance presupposes new economic governance, a new cooperation at the level of the global production chains, as it's been very well emphasized. And they failed to operate, to work, and they are driving countries once again to escape from a global vision that is complementary to a more isolationist, self-sufficient vision, each one on their own. And this will only worsen the deep lack of humanity in the current state of things. But I would now like to give the floor to Marcelo and the representative of PAHO, of the Pan American. No, I have just spoken. Now it's Marcelo. Okay, it's me, José Luis. Thank you very much, José Luis. Thank you very much to Minister Adalberto Jarbas and the dear friends from FIS Initiative. I'm speaking straight from the United States, Philadelphia, and a little bit of the history of us and our company as part of this context of the new economic and health order in the world.
I have been away from Brazil for almost 10 years, and about 2 years ago, because of the pandemic and everything that has been caused in all world systems, we haven't been able to get back to Brazil to visit our friends and our families. The first message is that the pandemic has changed our way of living and has still having a great impact in people's lives. Air Liquide, I have been in this group for 20 years. I was CEO some years ago, and many years I lived with my family in China, and now most recently in Philadelphia. Just for you to understand, the group Air Liquide Air Gas is a world group for gas technologies and services, both for industry and also for medical hospital industry. I think it is very difficult for us to talk about a pandemic, post-pandemic situation without talking about an essential product that certainly drew the attention of you, my co-panelist, which is the crucial importance of oxygen that has been key in treating COVID patients. And this is one of our, if not the main products in the world, and obviously the main one in healthcare area and the hospital area. All of you have followed in Brazil. I from here quite closely, so many emergency situations that are being faced. Professor José Luis, Dr. Barbosa, you talked about inequalities, what we've lived in the region of Manaus in the Amazon, despite the fact that the US is a first world country, very rich. Dr. Barbosa lives here. We've been through emergency situations, living critical situations regarding this fourth wave that has hit the US badly, especially in the southern region with a new variant, the Delta variant, creating several extremely challenging situations, I would say, from the standpoint of supply chain. One of the main inputs is key to life, which is oxygen. I use oxygen as an example to try to share the vision of the private initiative, our vision in terms of contribution to this new world economic and sanitary order. So it's a cryogenic product. In other words, it's produced usually in high pressures and very low temperatures, which means extreme difficulty to displace and transport this product. As any other product, it has production and transportation limited capability. I think it's being mentioned how frail the health systems are in poor countries, but I would include the rich countries. Many countries have suffered in the beginning of the pandemic. The US has suffered till now with the vaccination that has been proven a very complicated situation. We've seen what happened in Italy, news today, Germany with one of the highest rates of COVID dissemination since the beginning of the pandemic. And so the aspect of oxygen is fundamental. And the message or my takeaway message is importing, exporting this type of product is a great challenge. We are a global company with operations in over 80 countries, but we work in a very local fashion when we talk about supply chain. So this question by itself has created a great difficulty to all our industry in supplying this demand for oxygen that I believe could have been anticipated. I believe Mr. Jarbas Barbosa has talked about the difficulty in planning and anticipating what has been happening to COVID. This is a point I'm going to highlight, but we still find in regions in the US where the demand for oxygen has been multiplied by 3-4 times, especially now in the south of the country. Well, our lives have been changed. The companies have been suffering. The crisis is a road logistics crisis and of disruption of operations in various segments. And I'd like to leave 3 points for our discussion, perhaps reflection now and in the future within this new order that has been set up. And I believe it is intensifying. First, private companies require new management, risk management, and evaluation. We have to learn from everything that has happened in the past 2.5 years within the crisis, reevaluating our supply chains of production, distribution. We supply a basic product for public health, and it's been made evident that we need to revise these systems. Unfortunately, I say, medical gases are key, and they cannot always meet demands in different points of the planet if they are not produced and distributed locally. So industrial risk management, logistics, and business, this has changed and will keep on changing in private companies. The second point, which I think is quite important, and I believe it is to add to what Jarbas and Minister Adalberto have mentioned, there is a need, and we see this in cooperation with WHO in the handling of vaccines. It hasn't been perfect, but countries started having access. I think the coordination of sanitary authorities, of emergency management authorities like FEMA in the US, as the Ministry of Health did in Brazil, this dialogue has to continue. The pandemic should end, I hope shortly, but we may have an endemic situation of COVID that should change the level of incidence of respiratory diseases. This is very important because we need to plan and invest in the part of the companies to supply the health industry with key products. And I'd like to conclude with a question that was put forth and highlight technology and innovation, sustainability. And I believe the rich countries have demonstrated that the most advanced, their ability in creating and in making and distributing vaccines without forgetting with great pride our own institutions, Fiocruz and Butantan Institute, in the effort of producing locally with foreign technology, but the private companies have a fundamental role in the continuity of investment in innovation, research, and again, giving a practical example to the audience with us, the example of oxygen generation in a decentralized way, locally, in a more efficient way, consuming less energy and being able to meet the needs even of the most remote and poorer countries. This is a great challenge that we as a company have put to ourselves, and will continue investing in research and development to socialize the distribution and access to these products that are so important. Sustainability, well, I'd like to say if there is, this crisis has impacted society in a profound way. There is a need to have a development model that our planet should be more sustainable. Again, private initiative has a key role in this regard. I remember even here in the US during the previous administration, not prioritizing this topic, large companies started prioritizing it. I believe this topic has become much more evident during the pandemic. Public opinion has been a transformation agent, and I believe large companies like Liquida Gas have a key role in having a development process of our activities that can be sustainable. Financial goals have to be hand in hand with goals of using natural resources in a recyclable and sustainable and clean way. And this is a key role that our company and our industry has in this energy transition that is so important for this new world order, be it economic and sanitary. So I'd like to leave this with you, and I hand over back to you, and perhaps open up for questions with the time that we have left for questions and debate. Thank you very much.
Thank you very much. Everything you said was very interesting, and you really complimented, because I think we all agree, even though we have placed emphasis on the public aspect and maybe institutional and governmental in the previous discussions. I think that you put very well the role of the private initiative that is very important at this time of transition, where the transition, the energy transition, the world has gone through other major energetic transition when they changed vegetable coal by mineral coal, and then one mineral coal for oil. And now we are starting this trajectory, which is not going to be so short. It might take about 20-something years in the pursuit of a production of energy that is friendly in terms of the environment. And then the use of electric power, hydrogen, and alternative ways of production. But all of this, and I have a few questions and not enough time, I think there's something that there is a certain recurrence, is that in following up and watching it from overseas, the situation of Portugal. So I would ask this question to Professor Alberto. And we see that Portugal has demonstrated great agility, it looked to us, in terms of doing what was necessary. And I thought there was a major support, at least it looked like that to us in Brazil, and from the public opinion, where the public opinion here was very much divided. There was a lot of politics involved. And so the perception that I have is that in Portugal, that there was a sort of an alignment between those proposing measures and orienting and those following them. Am I right? Is my perception accurate? Yes, it is. Yes, we need to be fair and we need to compare the size and complexity of countries. So we are talking about a small country with about 10 million inhabitants and comparing to a country with 100 million inhabitants. But is this true? Portugal, at first, there was a factor that was determinant, which was the political agreement between the government and opposition. There was no dispute. So in terms of public health issues and whatever the scientific community proposed, they were well accepted by the population understood them, and there was no political fracture between the government and the opposition. As to the second phase, that the vaccination, Portugal is today the country in the world with the highest vaccination culture. We have 87% coverage. And this is a part of the Portuguese culture. The Portuguese like vaccines, and since 1964, the vaccination program in Portugal is very successful. So there is great compliance with vaccines. So with a logistic process that was quite demanding, in a very short period of time, we could vaccinate practically 87 or 88% of the population. Now we have started giving the third dose. What happens to vaccination, if you allow me? So we were well aware in Portugal, and I have been traveling all over Europe, Italy, Switzerland, and I have been talking to the colleagues in the WHO in Europe. We are aware that there is a wave coming from east to west, so that Holland is having very worrisome records, and we have the feeling, and also here in Portugal and Spain, are going to be hit by the same fifth wave. And what do we get from that? With the vaccinal culture, of course, the mortality is much lower. The main gain in this process is the reduction in mortality due to COVID, and also the reduction of severe hospitalizations. So the message that we need to convey to everyone, and we've been following up with the situation in Brazil with great interest, that Brazil is a country with a very scientific community of great value, is that science is fighting an unfair fight because people want certainty from science. People want science to provide black and white answers. And the vaccination process in terms of a smaller coverage, and this has been going on in Spain too. In Spain, they have a very good vaccine coverage, but maybe we need to look at the country, cultural changes, and as our colleague in the US used to say, we need to look when we see that in the US there is an issue which is very clearly social cultural. It's not related to wealth or poverty. It's related to something that happens in the US, which is very complicated in the United States. And I saw that in Russia very recently too. And I think that in Russia, the situation is even worse than it is in the US. But in any way, we are very proud about the resilience and the great capacity for adaptation of the Portuguese population to public health measures. Thank you very much. I would like to take the opportunity to thank your participation on behalf of the organizers. And I would like to ask two very short questions. The first is a question meant for Dr. Jarbas about this fifth wave. How is the WHO going to publicly take a stand on that, because when it started, there was some criticism that you were a little bit slow in saying that there was a pandemic going on, and some maybe mistakenly and unfairly use that to justify the lack of action. Even in Brazil, some authorities said that I don't want to cause any embarrassments to you, but we are really on the brink of a fifth wave. I have a daughter and grandchildren living in Germany, where the situation is very, very severe. What does the WHO intend to have a more aggressive communication about the fifth wave in terms of having a more aggressive communication to send out warnings about the severity of the fifth wave? It's coming from the East, as the professor said, yes. Well, but they are not rich countries. Dr. Jarbas, please. Thank you very much for the question. Let me try to be very objective. Number one, the pandemic is not a concept that is part of the international health regulation. The highest degree of alert in the current mandate of WHO is called public health emergency of international significance. When the WHO declared COVID-19, it wasn't even called an international public health emergency. There were very few cases, 400 cases, only 80 cases outside China, and no deaths outside China. About the statement. And then there was a whole debate whether it was a pandemic or not, because there is no objective criteria to declare it a pandemic. But I agree with you that the WHO defined 3 independent committees, 3 external assessment committees. And those committees had made many recommendations that needed to be adopted. But adopting the recommendations is not just up to the will of the WHO Secretariat. Because depends on countries, because whenever you give more power to multilateral organizations, you reduce a little bit for the common good, but you reduce a little bit the individual sovereignty of each country. So this needs to be taken into account. The epidemiological situation differs in different parts of the world. For example, here in South America, after we spent many months as the hub, we're having a reduction in terms of number of cases, maybe because of the high compliance to vaccination. In Latin America, if there's a vaccine, people will get vaccination, different from the US or Germany, also different from Italy, where in some regions they had denial, huge denial against public health, the pandemic and vaccine, and now these are the locations that are being most severely affected. Yes, we do have the instruments to control it, but it's not just up to public health. If vaccination increases and there are some groups that resist being vaccinated and they accept vaccination, it's proven that will reduce the number of cases, the number of deaths and transmission capacity. And this is local decision. It cannot be a global decision because each place is one place, they're all different. But for example, in the Netherlands, there is a recommendation that may be having a lockdown again for 2 weeks, because when they have a lockdown that is very effective in 2 weeks, and this combined with vaccination, they can control the rise of cases.
We have the instruments. The problem is how to make those instruments to be effectively implemented. We see this paradoxical situation. 5 countries in the Americas have not reached 20% of vaccine coverage. They haven't been able to protect the most vulnerable. In the meantime, the rich countries have bought 3 or 4 times the number of their inhabitants. They bought a number of vaccines, and with the anti-vaccine groups and politicization of vaccines, they cannot control transmission. And this, no doubt, is a point we have to greatly reflect upon to avoid incurring in the same problems in the future, in the short term, to respond to this pandemic and to future pandemics. Thank you very much. It's been very clarifying. It's been an honor to have you, your presence, your explanations, and also your institutional defense of such important organization at this time of world governance. For us to wrap up, I would like to hear Dr. Marcelo Fioranelli on the autonomy of supply chains. This within a world leader, global company, highly respected as Air Liquide, if this has somehow corresponded to some kind of change in strategy regarding these autonomies, regional autonomies that we may call them, considering the difficulties demonstrated by the very failure of making supply chains to operate. I'm not referring to oxygen in the case, even masks, aprons, gloves, things that you would say, well, how can the US depend on gloves from China or even drugs from India? Has this corresponded, in your view, to a change in the world organization of production in search of greater autonomy in these chains of production inputs? José Luis, thank you for the question. I'm going to try to be very objective. The answer is for sure. As I said, the whole process of reevaluation of our perceptions internally, the way we assess probability, risk, and impact of certain events within a very long-term vision. Our company works with a long-term vision. I'm going to give you an example. In the US, we already have a series of decisions of investments, both increasing production in some regions in the US. I'm going to give you the example of Florida that has faced, perhaps it was the region that was most impacted by the Delta variant. And when we make the planning of our inventory transportation systems, the road system and rail system that is very efficient, it has always been very efficient, it's totally congested, and also using technology, trying to create new processes of generation and production, meeting the needs of liquid oxygen in terms of quality and reliability, analysis, etc., so that we can no longer go through the situations we've been through trying to meet this demand. So I conclude by saying, José Luis, the problems we face here in Europe, industry in general, it hasn't been a supply problem. It's been a demand problem that has grown steeply, absurdly, and we have to understand the new level of volume. This has changed the way hospitals and doctors and institutions address the patient treatment protocols in general, not only with COVID and respiratory diseases that will depend certainly on greater volumes of oxygen. This is being analyzed and implemented as we speak, José Luis. Thank you very much, Marcelo Fioranelli, for your participation, objective and clear, somehow reassuring and confident regarding the future. We have gone beyond our time, and we have that says that is quite important. Stop everything that the muse thinks, because there is a higher power arising. What is this higher power? Well, 10 minutes ago, there was a Flamengo match here, football match, and our audience is not escaping. They are sending messages to me via WhatsApp. Okay, schedule a continuity, something else. It's just fantastic. But now we have to honor our football team that actually is going through the greatest moment in its history, thanks to the coach it's had for 3 years, called Jesus. Yeah. So with my thanks to José Villar, the organizers of this event, I feel honored to be able to listen to you firsthand, clarify many questions, and understand the profound human meaning of these interventions that you, my dear panel members, have offered to me and our Brazilian audience. Thank you very much and have a good evening. Thank you all very much. Thank you. Good evening.